Day 3 here for the SHIP training. We've gone over a lot of information regarding Medicare, regarding financial assistance, and fraud and abuse. But I always do find it to be pretty helpful if we can also look at why are we doing what we're doing? What is the purpose behind us doing all of this, and what are our performance measures that we as a state are looked at and looked upon when we're being judged from our funding sources? So just in terms of SHIP, we've got a few performance measures. We're going to go over what performance measures we do have in regards to just the plain SHIP program, as well as for the MIPA program, which is the program that we run, which enables us to give that financial assistance help that we give when helping beneficiaries complete those financial assistance applications. So with the SHIP program, we have 5 performance measures. They're laid out right here. Hopefully everybody can see my screen. I'm hoping so. If anybody wants to just confirm that in the chat for me, I'll see that. Yeah, it looks good. Perfect. We have 5 performance measures. Performance measure 1 would be total client contacts. Performance measure 2 is outreach contacts. Performance measure 3 is Medicare beneficiaries under the age of 65. You may also hear that as disabled beneficiaries as well. PM4 is our hard to reach contacts, and then PM5 is our enrollment contact. We do have a short blurb about the particulars of each one of these performance measures right here, and we will go a little bit more in depth on each one of these through the remainder of these slides here. So what happens when we are going through our performance measures is based off of how we score in our performance measures, we are given a rating in each one of our performance measures. If we're in the top 10%, so the top 5 states within our nation in SHIP programs, we are given an excellent. If we're in the top 20%, we're given a good. That's the next 11 states, so top 16. If we're in the middle there, we're given an average. That's the 22 states in the middle there. If we're in the second to lowest 11 states, then we're given a fair. And if we're in the bottom 5 states, we're given a low rating in each one of these performance measures here. And I will let everybody know how we've done after we've gone through everything. What reporting periods we have with our performance measures? The SHIP program runs in a year that runs from April the 1st of any given year through March the 31st of the following year. So for example, the current SHIP reporting year that we're in is April the 1st of 2020, and that will end on March the 31st of 2021. That is when we're running reports on how we performed during the year. For the SHIP program, that's when we run reports, April through March of each year. We do submit quarterly reports to sort of keep track of how we're doing. All of the coordinators do send me a quarterly report, and I will be sending ACL quarterly reports just to keep track of how we're doing and you know, how we're progressing and if we're able to keep up with what our goals are for each year. Now, performance measure 1, I told everybody, was total client contacts. This is the percentage of total client contacts that we assist in person, in office, or in that person's home, by telephone, contacts by email, contacts by postal mail, or fax per Medicare beneficiaries in the state. Essentially, what we do is we look at what are our total population of Medicare beneficiaries within the state of Tennessee, and we set a goal for ourselves of reaching a percentage of those Medicare beneficiaries. Currently, our goal is trying to strive to reach 8% of our Medicare population. Now, what we do is that anytime we make contact with a person and we are speaking about Medicare, whether that be somebody that we talk to, you know, at a senior center, community center, if we go out to that person's home, if they call us, if they email us, if they send us a letter in the mail or a fax back and we respond to them and are exchanging Medicare information, we count that as a client contact at that point. What we would do is when we're counseling somebody or even just speaking about what Medicare is and when someone can expect to receive Medicare, anything Medicare related, we mark that down and make sure that we mark certain things. We'll go over what all information we ask about when we're looking at stars later on today for how we typically key in or what client contact forms that we use when we're speaking to these Medicare beneficiaries. But each time we speak to any individual person, that is one contact that we have that goes towards meeting this performance measure goal. So that is individual one-on-one conversations and exchanging of Medicare information that we have with a beneficiary that goes towards meeting performance measure 1. Performance measure 2 is our outreach contact. Excuse me. This is anyone that we speak to at any of our outreach events throughout the year. That is reached through 3 particular things: presentations, booths that we have at health fairs or community events, and at enrollment events that we hold through each year. And that is the only 3 things that we do count towards performance measure 2, is those 3 things: presentations, booths at health fairs or events, and enrollment events right there. To count that, you must have the ability to monitor attendance, and you must provide an opportunity for participants to ask questions or ask for clarification of the information at the time of the presentation. For example, this would be considered an outreach event if one of the coordinators or myself was giving this presentation to the public, and we've said, hey, for everyone who's in the, let's just say, the Shelby County school system, everyone in the Shelby County school system has received the link to this webinar, and we're presenting. As long as I can look and see how many people are attending this and they have the opportunity to ask questions or ask for clarification during the presentation, then we can count that towards a outreach contact at that point. Sorry. Have the ability to monitor attendance. That there are a couple of things that we do make sure of when we are going out and doing events with the program. We monitor attendance by how many people come by our table. For example, I'll give the example. When I worked in Johnson City, we would do the Greene County Fair and the Appalachian County Fair each year. There were probably anywhere from 6,000 to 10,000 people who would attend that health fair. However, not all of those people would come by our tables. So what we would do is we would keep account of about how many people came by the table, as opposed to how many people typically turned out to the fair in general. The reason for that is that we're not trying to take a number just based off of the potential of people who come to that, but rather trying to get a real count of how many people are coming by our table when we're getting a count of the attendees that we have for a booth or anything like that. For a presentation or for an enrollment event, you can typically have that count a little bit more specific. you know, with a sign-in sheet, or you can tell by how many people you assist at that enrollment event. With those health fairs, though, we do, you know, want to make sure that we try to get that count as close as possible if we can, but we are able to estimate a little bit more with those, since, you know, if one person is running a table and handing out information and trying to make conversation with people, we can't always have a specific count of how many people are coming by the table and trying to get information. Just a helpful tip too is any time that somebody comes by the table and looks at your information and has the opportunity to speak to you, you can count that. If somebody were to come up to me and ask me, you know, for specific information about Medicare and want to exchange that information face-to-face with me, I, myself, and many of the coordinators will keep a sheet, you know, at their table, and they will make sure that they mark down the information that we do need to make that a client contact form at that point, and then we'll enter that into our data system later. So while you're getting outreach numbers, you may also be increasing that Performance 1 total client contact number as well. Now, Performance Measure 3, like I told everybody earlier, is our Medicare beneficiaries under 65. Again, this may also be known as our disabled contacts. This is the percentage of people that we talk to in the state of Tennessee who are receiving Medicare under the age of 65. What that means is that this contact is anyone under 65 and is receiving or applying for Medicare and Social Security benefits due to disability, or receiving Medicare because of end-stage renal disease. As was gone over on Tuesday, trying to remember the days of the week here, but on Tuesday, there are 3 ways that you can qualify for Medicare, one of which being that you attain the age of 65, and the other 2 being that you must be receiving Social Security disability benefits, that's SSDI, not SSI, Social Security disability benefits, for 24 months, or be receiving Medicare because of something like end-stage renal disease or ALS or Lou Gehrig's disease. So for anybody that we are contacting through client contacts who meet those categories, they're under 65 and receiving Social Security due to disability or due to something like end-stage renal disease or Lou Gehrig's disease, then they would count towards Performance Measure 3. This would mean that, for example, if I spoke to somebody, you know, tomorrow when we're not on a conference call here or not on a web training, that if I talk to somebody and this person is a female who is 54 and has been on Social Security disability benefits for 24 months, and I speak to that person and counsel them on Medicare and complete that, when I enter that information into our data system, or if I was a volunteer, when I report that to my volunteer coordinator, if I'm not entering data myself, then that will count for Performance Measure 3 because that person is under the age of 65 and receiving Medicare due to disability, but it also does count for Performance Measure 1 as well. So Performance Measure 1 is sort of our overreaching performance measure, that these will just be what percentage of those people are also receiving Medicare due to disability. This is typically and historically our hardest to reach performance measure, simply because there's nothing that we can really do to control how many people we're speaking to who are on Medicare due to disability. There's nothing we can really do to control how many people are on Medicare due to disability. The best we can do is try to make contacts and try to develop a partnership with a disabled group, or try to make sure that we're covering and presenting to as many disabled groups as we possibly can. But aside from that, we can't control how many people are contacting us who meet those qualifications based off of age and based off of disability or end-stage renal disease. Performance measure 4 are hard-to-reach contacts. These are the percentage of low-income, rural, and non-native English contacts per total hard-to-reach Medicare beneficiaries in the state. Now, that definition that I just read that's at the top of the screen makes it seem a little bit more convoluted than it seems. It's made up of all three of those things. So that's contacts that are designated low income. They fall below the federal poverty limit that we went over yesterday. They're in a rural county, which we will go over what is designated as the rural counties of Tennessee. Not everybody will agree that all of those are the rural counties. They will want to add other particular counties, but these are the rural counties that are designated from higher up than us. We do not make that call ourselves. And then non-native English speaking. Some Medicare beneficiaries may have more than one category. Thus, they may be counted multiple times in numerator and denominator. But we will go over a better classification of non-native English speaking a little bit later on. But just as something right now, this would be somebody who English is not their first language, or as ACL has determined it, somebody who you have reason to believe that English is not their native language. So they do leave a little room to make that decision yourself, but that is what ACL has determined as the rule for that. Again, that will be on a presentation a little bit later, so we'll get the specific on that a little bit later on. Yeah, and basically with this calculation, the way that they make sure that they calculate that is they would take the total beneficiaries in the state and then the total contacted by SHIP, and they would just divide the total contacted by SHIP by the total beneficiaries of the state to get a percentage. So they would add up all low income, all rural, all non-native English speakers within the state of Tennessee. ACL does provide that information to us. I will happily show everybody that information today when we're in the STARS system, where you can see ACL's information about where we can pull to see how many Medicare beneficiaries we have in the state, how many Medicare beneficiaries are low income, how many are rural, how many are non-native English speakers a little bit later on. But basically they add up the total beneficiaries in the state, then they look at the total contacted by us, and they add up all of those together and then just divide the totals of each one of those to get the percentage of people that we've reached. Again, our goal for all 5 performance measures is to reach 5% of our Medicare population here in Tennessee. So we'll go on to performance measure. I don't know why it keeps pushing me back. To get a little bit into more specifics here on the performance measure 4, low income contacts or contacts with beneficiaries whose income is below 150% of the federal poverty limit. That is below those figures that I gave you for extra help earlier. So if a person is below the income limit of $1,615, then they would be below 150% of the federal poverty limit. If they're above that, then they would be counted as above the federal poverty limit. If they were above that, then obviously they wouldn't be counted for performance measure 4. If they were below that, they would obviously be counted towards performance measure 4. In the scenario that I gave you on performance measure 3, if that person, that woman that I spoke to, who was under 65 and disabled, if she also was below 150% of the federal poverty limit, then that would mean that in that one client contact, I would have had a contact that counted towards performance measure 4, performance measure 3, and performance measure 1 all in the same time at that point. A rural contact is contacts with a beneficiary whose zip code is loaded in a county classified in a non-metropolitan category. Again, this is classified by ACL. I will go ahead and pull this up right here. These are our rural counties in the state of Tennessee deemed by ACL. In ACMS's region, Lauderdale is the only rural county. In First, that is Greene, Hancock, and Johnson. In South Central, it is Bedford, Coffee, Franklin, Giles, Lawrence, Lewis, Lincoln, Marshall, Moore, Perry, and Wayne. In East Tennessee, that is Claiborne, Cock, Monroe, Scott, Sevier. In GNRC, that is Houston, Humphreys, Stewart. In Southeast, that is Bledsoe, Grundy, McMinn, Meigs, Ray. In FCS, that's Decatur, Hardeman, Hardin, Haywood, Henderson, McNary. In Northwest, that's Benton, Carroll, Dyer, Gibson, Henry, Lake, Obion, and Weakley. In Upper Cumberland, that's Clay, Cumberland, DeKalb, Fentress, Jackson, Overton, Pickett, Putnam, Van Buren, Warren, and White. I am sorry if I mispronounced any of those, but we'll just move on from that. With non-native English contacts, this is, like I said earlier, it would be a client that should be considered non-native English speaker if A, they can answer no to is English your first language, or B, if the counselor can reasonably conclude that the client is not fluent in understanding, speaking, reading, and or writing the English language. That came straight from ACL. I really, when we were trying to get these presentations together, I tried to get them to give us what their definition of non-native English speakers is, simply because you know, a lot of people don't feel comfortable with having to ask that or having to ask gender or race, ethnicity, or a lot of things that we do typically ask people for. As you can see with most everything that we have in the SHIP program, when we're asking people to try and collect information, we do have not collected on most things. So people who are not able to collect that information do not have to guess at anyone's race, ethnicity, language, gender, anything like that. We do try to collect that information if we're doing a client contact, but as we all know, we can't always collect that. So not collected is, of course, on there, but the way that ACL defines that is if they can answer no to is English your first language, or if the counselor can reasonably conclude that the client is not fluent in understanding, speaking, reading, and or writing the English language. Performance measure 5 is our total unduplicated enrollment contacts. So basically when we're doing a client contact, let me see if that is on here, yes. When we're doing a client contact, we basically fill out a form, or if you key directly into our data system that we will go over later today, you have a list of topics which a person can mark for all the topics that we typically do cover with people in regards to Medicare. Now, there is, of course, you know, a million topics that anybody could cover. Not all of the topics, you know, that you may speak with somebody about are on there. I would say a majority of the things that we normally deal with are on that sheet. There is an opportunity for you to put other and then put the specific topic that you speak of, but most of the time the topic that you're going to speak to somebody about will be on that client contact form and under those topics that you can select. But basically, this is essentially, we count these people as people that have, it's the percentage of people that have unduplicated topics that are leading towards enrollment. There's 18 possible enrollment topics, and that's going to be right here on the next page. These are the 18 things. Speaking about prescription drug coverage, those are your eligibility for drug coverage, a plan comparison, a plan enrollment or disenrollment, and a plan non-renewal. For extra help or low-income subsidy, that's eligibility and application assistance. If you're talking to a person regarding Medicare Parts A and B and you speak to them about eligibility, that's one of the qualifying topics. For Medicare Advantage, the same as prescription drug coverage. That's eligibility and screening. That's, do you have Medicare Parts A and B, to try and screen them to see if they're eligible for Medicare Advantage. Same thing with prescription drug. It would be, do you have Parts A and or B, since you can get prescription drug coverage without both A and B. That would be plans comparisons for Medicare Advantage, plan enrollment and disenrollment, plan non-renewal. For supplemental policies or Medigap policies, that's eligibility and screening. That's plan comparisons and plan non-renewal. And if you're speaking to somebody regarding Medicaid, that's Medicare Savings Program screenings, Medicare Savings Program application assistance, Medicaid screening, and Medicaid application assistance. If you fill out that paper application or you go online and fill out that application, now that TennCare has consolidated all applications for TennCare into one application, by submitting that application, they are trying, and you're putting all of that information that would lead towards them trying to qualify for as much TennCare as possible. If you're filling out that form completely, you're doing a Medicaid application as well as an MSP application at that point. So, for example, if the person, the female that I talk to tomorrow, in the example that I gave earlier, who is under 65 and disabled, and also English is not her first language, if I talk to her tomorrow and talk to her about prescription drug coverage and Medicare Advantage and Medicare Supplement, and I did a comparison for all of those. So I've done eligibility and screening. I made sure that she was eligible for all of these. And then I did a plan comparison at that point. So I've marked all of those things, and that's one contact. If she were to call me back on Monday and said, I looked at this and I think I want to go with the prescription drug coverage, I want you to sign me up for that. Then at that point, I may still mark eligibility and screening, but once I'm enrolling that person into a plan, then I would mark plan enrollment. That becomes an unduplicated contact at that point, because I have now marked something different than the time I spoke to them before. If she called back and she just said, well, I just want to talk to you about what you sent me, and I can only mark plan comparisons because I was going over those comparisons again with that person, that is not an unduplicated contact. Anytime where I'm talking to the same person multiple times, but through the course of that counseling, I'm able to mark something new that we have yet discussed, then it becomes an unduplicated contact at that point. So if that person calls back 3 or 4 times, and after the second time where I enrolled that person into a prescription drug plan, she calls me back on Wednesday and says, hey, I need some information about supplemental policies, and where that's not a good example because we can't enroll somebody into a Medigap policy, but they say that she says, okay, well, you signed me up for this drug plan, but I'm thinking that I might qualify for low-income subsidy now. And I talked to her about either extra help or Medicaid, then I would mark those particular things on there, and then at that point, it becomes a third unduplicated contact there. So obviously, the more times that we talk to somebody, we don't want to push anybody to make a decision when they're not ready or anything like that. But if the conversation is moving forward, if that person is ready to move on and discuss new things or make a decision on those, we make sure and mark those correctly on our client contact form, so we do get credit for those enrollment contacts. Just wanted to go back. Okay, that's all 5 of those. What I'm going to do really quickly here is I'm going to stop sharing this screen really quickly, and I'm going to just check the questions here really quickly to make sure that about how many Medicare beneficiaries are in the state of Tennessee. I believe that was covered on Tuesday. Let me go and I'll give you the specific number right here. We have 1.27 million Medicare beneficiaries in the state of Tennessee. What are the percentage goals for different performance measures? You said performance measure 1 was 8%. Yes, all performance measures are set at 8%. Oh, and I told everybody that I would mention it. We actually were able to reach 8% in all but one performance measure. We reached excellent in performance measure 1 through 4, and we got a good in performance measure 5, which is the second step down. I believe we reached 7.8% of our goal. So we were right below 8% of our unduplicated contacts as well. And that may be due to really, it was only until this year that ACL was quite clear with us about how we can, about what they're looking at to monitor those unduplicated contacts. So I would guess that in the future we're not going to have any issue reaching that. How is rural determined? ACL makes that determination, and I believe it's based off of population and then vicinity to a metropolitan area, but I don't have the specifics of how they make that determination right here in front of me. Does each person have to meet all 3 of these criteria or fall into one of them? I would assume that would be in respect to performance measure 4, which is our hard to reach contact. To count for performance measure 4, they only have to meet one of those criteria to qualify as a hard to reach contact. Who calculates the federal poverty level, and when, how often is it updated? How do we get that information? I can send our cost tip sheet to the coordinators who can share that with you. Most of them already have that and can share that information with you. TCAD, or who sets the federal poverty limit? I'm not sure who sets that right off the top of my head, but we get that information in March to April of each year and update our numbers based off of that. TCAD and Social Security will provide us with their listing of their numbers for meeting all of the guidelines around March to April of each year. Why is it that Tennessee SHIP cannot enroll beneficiaries in Medigap plans? It's because those plans are run by, excuse me, individual private insurance companies, and unfortunately, they do require licensed insurance agents to enroll people into those plans. You know, the other coordinators can feel free to put in the chat. I've never experienced a large number of beneficiaries who've had trouble getting enrolled into the plans. Obviously, if they're within a guaranteed issue rights period, that makes a big difference between somebody who calls us who does not have any guaranteed issue rights period, meaning that that plan has no legal obligation to sell them that plan. For somebody who does not fall within one of those guaranteed issue rights period, I may get a call where somebody says, well, they won't sell me this plan based off of my medical history, but in terms of somebody who's, let's just say, new to 65, or who's newly 65 and is within their initial enrollment period and has a guaranteed issue rights period for a Medigap policy, I do not typically have people who call me back and report any sort of issue with getting that Medigap policy. Okay. So, I don't know that I'm sharing the right screen here. Let me make sure. Okay. Everybody can see the Adobe PDF that I'm sharing, correct? Yes. Okay. Yeah, awesome. This year will be the first year, starting in October of this year, that we're also going to have MIPA performance measures as well. Again, MIPA is the program that we have that we are given this grant in order to enable us to help people with those financial assistance applications. It is what enables us to take that on. Previously, those applications were handled through the Department of Human Services. But now we are responsible for handling those applications. I still believe that DHS will fax in those applications for people, and I'm sure that people at DHS are still helping people complete those applications, but we have taken on the responsibility of helping people complete those applications and helping them get submitted, whether that's mailing them an application, allowing them to fill it out and mail it themselves, whether we send them that application and they fill it out and get it back to us and we mail it in or fax it in, or whether we're helping them complete it and helping them get it mailed off or faxed in all in one go. We help people complete those applications. Now, this is going to be a little bit of a tricky slide because there's only 4 performance measures. However, performance measure 3, the MIPA target populations, is going to be broken down into about 3 or 4 specific categories. We'll get to that once performance measure 3 comes up, but just know that overall there's only 4 performance measures for MIPA. The criteria for all MIPA performance measures is that when we're talking to somebody, anybody that we speak to, a client contact, that we screen them to see what their income is. If we are asking somebody about their income to try and determine whether they're low income, we would mark yes to MIPA. If you do not talk about that on the phone call, or do not talk about that with that person when you're face to face, or don't mention it in your email, letter, anything like that, then you would not mark that. However, you know, I myself and a lot of the coordinators do make sure that they ask somebody in every contact, regardless of whether we suspect that they're low income or know that they're not or anything. We do ask, hey, just to make sure, you know, do you have any problems paying for your medications, or do you have problem paying for your doctor or hospital, anything like that, to try and find a way to ask that person, you know, what their monthly income is or whether they are low income. You know, I know for some people they may not feel comfortable asking somebody what their monthly income is. I've been doing this for 7 years, so, you know, asking somebody a question anymore doesn't really faze me. I don't get too embarrassed or feel uncomfortable asking that. And most of the time when you're asking somebody, you know, to try and help them save as much money as possible, they're pretty happy to tell you whether they at least are looking for assistance or would be interested in trying to see if they can qualify for assistance at that point. And then obviously, you know, to count as MIPA, the client contact form must say MIPA. This portion up here, the initial criteria, when we enter any of our volunteers who are submitting data to us into the data system, we make sure and mark what programs that volunteer is going to be assisting with. So for example, if Lonnie had a volunteer who was only trained in fraud and abuse and had received no SHIP training or no MIPA training, then she would just mark that volunteer as a SMP person and no SHIP or MIPA. Now, Lonnie would not do that. She would give somebody SHIP and MIPA training the same way as that for the vast majority of everyone who we train, they are meeting all three of these because they've received training in all three of those categories. But for example, if we do have a volunteer who only focuses on filling out applications or is only a data entry person, then maybe they would be marked as only SHIP and wouldn't have the ability to log any MIPA contacts in for themselves. But for the most part, we don't run into that. Now, performance measure 1 is our overall MIPA contact. Like performance measure 1 on our last slides here, this is the percentage of total beneficiaries that we speak to in the state of Tennessee who are on Medicare, but the qualification now is that these are the total Medicare beneficiaries who we speak to who are on Medicare, who are also under the federal poverty limit in the state of Tennessee. So now we're taking the total percentage of Medicare contacts that we have and looking at what percentage of those people were low income. And at that point, you know, you have to make sure that MIPA is marked, like we said, when you're filling out that client contact form, and also that at least one of the subtopics or topics that we looked at earlier, that list that you saw when we get to stars later on today, you'll see that that's pulled straight from the data system that we use. At least one of the following topics must be selected. Under the Part D low-income subsidy, you must mark application assistance, application submission, benefit explanation, eligibility/screening or LINET/BAE. Under Medicaid, application assistance, benefit explanation, buy-in coordination, eligibility and screening, Medicaid application assistance, MSP application assistance, or recertification. Additional topic details, preventative services may also be marked and still count towards MIPA as well. So this is the total low-income Medicare beneficiaries who we speak to in the state of Tennessee, who we've spoken to over the phone, through email, through mail, through fax, or face-to-face, either in your office or in their home. Now, performance measure 2, like performance measure 2 under SHIP, is the total number of people reached through outreach. It's just what percentage of the people that we reach through outreach are also low income at that point. So group outreach forms with the following criteria. So when we're putting this into the database, whether you're reporting that to your coordinator or you're putting the data in yourself, you have to have at least one target beneficiary group below selected, that being low income or rural, and at least one of these topics marked, that being extra help, Medicaid, MSP, or preventative services. So essentially, you need to be giving this presentation or setting up this booth or holding this enrollment event in an area that would include low-income or rural beneficiaries who would be attending, and also you must discuss low-income related topics at that presentation, at that booth. You must have information there on these services, anything like that. Again, preventative services is also included in that. Performance measure 3. Now, this is the one that breaks down into a number of subcategories. So we'll go through each one of these individually past this point. But this is the total number of beneficiaries who are below the federal poverty limit and are also under the age of 65 and disabled, are rural, are Native American, or are English as a second language. So they must, to meet performance measure 3, they must be one of the target beneficiary groups, that being under 65 disabled, rural, Native American, or beneficiaries with English as a second language. And at least one of these topics, application assistance, application submission, benefit explanation, eligibility screening, LINET and BAE, or under Medicaid, application submission, benefit explanation, buy-in coordination, eligibility and screening, Medicaid application assistance, MSP application assistance, or recertification, or preventative services. So if they meet that, they must also have one of these topics marked for that to count for our MIPA performance measure as well. Again, I told y'all that these are broken down. So for example, again, like we saw on the SHIP performance measure 3, these are contacts for somebody who is under the age of 65 and receiving or applying for Social Security disability or Medicare disability that will count towards that. It'll just be what percentage of those total people under the age of 65 and disabled are we speaking to that are also low income as well. For rural beneficiaries, again, that will be anyone who is in those listed rural counties right there. Again, we do not set those counties ourselves. I know that for a great number of people that there are at least 10 or 12 more counties that everyone could bring up and say, well, this is also a rural county, and I would doubt that your coordinators in your region or myself would argue with you. It's just what ACL has set as being those rural counties. We always try to push for the counties that we believe are rural to be added on to there, but unfortunately, you know, we cannot change those ourselves. So anybody in those rural counties who are also considered low income or below the federal poverty limit, we would put that on there. Native American populations, Native American beneficiaries. This includes any contact with anyone who selects one of the following under beneficiary race. If they select American Indian or Alaskan Native, being this one right here, or Native Hawaiian or other Pacific Islander, right here, then that would be marked, that would count towards performance measure 3 for our Native American population. And again, beneficiaries with English as a second language, just like we talked about under performance measure 4 on the SHIP performance measures. That is anyone who, a beneficiary with English as a second language, if they answer no to is English your first language, or if the counselor can reasonably conclude that the client is not fluent in understanding, speaking, reading, and or writing the English language. Performance measure 4 is contacts with applications submitted. So how many people who we are talking to regarding low-income subsidy, whether that's through extra help or whether that's through the Medicare Savings Program, how many people that we talk to about that are we actually helping them with the submission of their application? That being, we're mailing that in that in for them, or we're faxing that in for them, or we're filling that out with them over the phone with TenCare or with Social Security, or we're filling that out online with them through Social Security or through TenCare. So when we are speaking to these people, they must be low income and they must have at least one of these topics marked on there. Under low income subsidy, extra help, they must have application submission marked. Under Medicaid, they must have application submission or recertification marked for a Medicare savings program or for the Medicaid application right there. For these performance measures, we are setting the goal for these performance measures at 8% there. Currently, I have no reason to believe why we would not be able to reach that, since we are, without even having any performance measures and without having any goals set up, we've exceeded the goals that are there already. So I don't expect that to be any sort of issue at all. Going forward, I do not see any questions right here either. So what I'm going to do is I'm going to go ahead and move on to confidentiality right here. Okay. Now, see if I can extend this to full screen here, because nope. Okay. Hopefully everybody is seeing the full screen version and not the black screen. Yeah, okay, great. I did want to talk about confidentiality. As we're making confidentiality a bigger push this year, as well as CMS has asked me to make sure that I make confidentiality a big push. We will be offering more confidentiality training each year, as well as going forward, we will make sure that everyone does sign a confidentiality agreement on an annual basis. I'm probably just going to add that on to the end of our already existing test to try and not make any more additional paperwork for you all to have to remember to fill out, and also for your coordinators to have to remember to get to you, to try and make that as easy as possible on everybody. I am going to show everybody kind of an example of one of those confidentiality forms that CMS has as a sort of usable thing, and how I'm going to try and just change the wording on that a little bit to try and be more useful for everyone. But I did want to just go over a quick confidentiality presentation and make sure that, since we've talked about a lot of Medicare, and please do believe that I am under no expectation that for any of you who this is your first, 1, 2, or 3 days receiving any of this information, you are not expected to be a Medicare expert after this. Far from it. Any person who's volunteered for this program for a number of years, or who's been a coordinator for a number of years, tells you that every single one of us, after the first time we heard all of this information, were like so scared and felt like we didn't know anything. Trust me when I say that there will come a day where everything clicks and makes sense, and you can remember all of that. I always tell anybody it takes about 6 months to feel comfortable, and it takes about a year to feel confident with all the Medicare information. But once it's in your head, it just won't leave, and it becomes quite troublesome to have the burden of knowledge there, because then everybody who knows that you know about Medicare will ask you plenty of questions. But with the knowledge and with the ability that we have with the program, we also are responsible for maintaining the privacy of a lot of the people that we help, and also with conducting ourselves in a way that is correct with what we need to do with the program. Just really quickly, what we're going to do is just define confidentiality and its implications for our SHIP and S&P counseling work. Look at a couple of confidentiality laws, policies, and implementation. Sorry, that didn't want to come out quite right. For SHIP and S&P operations, identify best practices, set our expectations, and meet what CMS needs for our unique ID training requirements. So what is confidentiality? To confide means to trust in someone, especially when sharing secrets or private matters. Confide is usually a pretty personal and a pretty serious thing. When somebody would say to you, I need to tell you something, or somebody says, can I confide in you something? They mean the same things, but just through, our language, one of them has an entirely different connotation than the other one. Confide usually means I'm going to tell you something with a little bit more weight to it than, hey, can I tell you something real quick? That typically feels more like a gossipy term. But when somebody's confiding in you, that means that they're trusting in you to hold on to something. Confidence means firm belief, trust, and reliance. Belief that we had our SHIP hotline spoof from people that don't or I wish I've heard about confidentiality in SHIP and S&P work. HIPAA, our Health Insurance Portability and Accountability Act of 1996. This is a privacy rule about rights and access to records, and a security rule, data protection, duties, and penalties. HIPAA is something that we maintain at all times. Obviously, for our coordinators that work in the same office, exchanging information with somebody, client who they're helping, and they're trying to brainstorm a different avenue in which they can try to help somebody who's been struggling to get something done. That is perfectly okay within the course of your job. For the coordinators who send me people's information so I can try and get in contact with TennCare and resolve any sort of issue with the Medicare Savings Program or anything like that, we share that information, but we always make sure that we protect anyone's personal information when we're exchanging that. We make sure not to be in the halls of our offices and exchanging personal information with people. We make sure that if we're assisting people with jobs and we're writing down their personal information and doing comparisons and everything like that, that once we're done with that file, either we upload it, put it in our data system and shred it, or if we're going to hold on to that, we've got that in a protected, locked, private location where nobody has access to anyone's information. We have constitutional privacy rights in some states and privacy and data breach acts. We've got our agency policies. I would bet that every single area agency book that they have on all their policies and procedures includes a pretty lengthy section regarding confidentiality. And I would bet that for a lot of you, you go through HIPAA training on a annual or multiple time a year basis. We do also have our VRPM, that's our volunteer risk and program management policies that we do require everybody to sign and initial the last 2 pages of that, agreeing to everything within that policy and that manual. And we've got a CMS UID, unique ID for SHIP and S&Ps, which, for a volunteer who's counseling, who's going to get a CMS unique ID, it's a number that we can give to CMS users who can recognize that we are SHIP representatives and that we can exchange information on the behalf of somebody. Again, like we talked about yesterday or the day before, there are still times where I call and give my SHIP unique ID or CMS unique ID, and I still do not have success with people wanting to talk to me. But we do have that to where we can continue calling and try to get in contact with somebody who does recognize our IDs and help people more than the normal person who's calling in who may not have the same sort of access as we do. And also, as was suggested, we can conference call with people, ask them to come into our office, not right now with the pandemic that's been going on, but hopefully soon we can have people come back into our offices and everything like that and sit and have them call with us on the phone. HIPAA's two parts, defines protected health information, or PHI, establishes permitted uses and disclosures of PHI, and regulates authorized uses of PHI, and limits uses and disclosures to a minimum necessary. Their security rule addresses safeguards for electronic protected health information, or ePHI, requires covered entities to ensure confidentiality and integrity of all, and identify and protect against anticipated security threats, protect against anticipated impermissible uses or disclosures, and ensure the compliance by their workforce through training and oversight. Training of which we are doing right now, and oversight we always do make sure that wherever everyone's files are being located, that they're keeping those in a secure location in a locked cabinet when we come and do quality assurance visits as well. Who does HIPAA apply to? Covered entities and their business associates must comply with privacy and security rules. This includes any health plans, includes Medicare health plans, also known as Medicare Advantage plans, Medicaid, Medicare supplemental insurers, Medigap policies, group health plans, any healthcare providers, that being hospitals, nursing facilities, physicians, etc., healthcare clearinghouses, billing service, health management information systems, business associates, a person or organization that contracts with a covered entity to perform some of its functions. All of our entities that are serving us are required to comply with HIPAA to protect our information, to make sure that it does not fall in the hands of somebody who is going to use that information in any sort of nefarious act. Does HIPAA apply to SHIP and S&P? These programs are not covered entities, but local co-sponsors may be covered of entities if they provide healthcare services or contract with those who do. Most third parties with whom SHIPs and S&Ps interact are covered entities, i.e. Medicare, Medicare Advantage plans, hospitals, doctor's offices, 1-800-MEDICARE, etc., and the U.S. Department of Health and Human Services, HHS, Office of Civil Rights, OCR, oversees and enforces HIPAA compliance. SHIPs and S&Ps can help clients submit complaints about suspected violations to the OCR at this website right here, which we can always make available to everybody. It is on the information that I emailed out to everybody yesterday. The HIPAA privacy rule is a federal law that protects all individual identifiable health information held or transmitted by a covered entity or business associate in any form media, whether electronic, paper, or oral. It's called protected health information, or PHI, like we talked about earlier. So that's anything electronic, anything on paper, or anything you say can be individually individually identifiable health information. That was a tongue twister there for just a second. So basically, to try and put this in more layman's terms, you need to make sure that what you're writing in emails, what you're putting down on paper, and what you're saying to people does not include protected health information in there. For example, if my spouse were to come home and she was asking me about my day and I had gone on a home visit that day, you know, I could say, well, I visited an individual in East Tennessee, but I could not say I visited somebody down the road from right here, or I could not say I visited Mrs. So-and-so or anything like that, or give any sort of identifiable information. You want to make sure that you're not giving away anything that is protected information right there. I'm going to go through here. A lot of this is going to be deep in the weeds here, but I want to make sure that I'm not repeating things too much and that I'm not getting too deep in the weeds with anything. Security risks safeguards. Covered entities must protect against reasonably anticipated threats to and impermissible uses and disclosures of protected health information by covering risk analysis, implementing administrative safeguards, building physical safeguards like putting a lock on a drawer or anything like that, installing technical safeguards. That's why all of our IT people have made sure that, you know, it is as hard as possible for anyone who's trying to scam or get through our firewalls or anything to get in and pull data from any of our systems, and documenting policies and procedures to make sure that no security risk like that happens. Covered entities, including healthcare providers, can't disclose individuals' PHI without written consent or the individual's presence and oral consent. If not, then they must use consent forms to document authorization or make three-way calls with provider or client on the line. That's why typically a person is not as likely to give us any sort of information if that person's not there to give their consent. Customer service representatives at 1-800-MEDICARE can't discuss a client's PHI with third parties, must use CMS unique ID to conduct SHIP and SMP work. Again, not all of them may have been trained to recognize our CMS unique IDs. They're supposed to, but you know, again, I would be lying if I said that nearly everybody with the program doesn't have an experience where they said somebody won't talk to me or doesn't recognize this or that. So just be prepared for that. Privacy training is required by you know, Medicare when coming to discussing those things. And electronic transmissions containing PHI must be secure using email encryption. Yes, security breaches occur when unauthorized persons gain access to PPI or PHI by stealing computers or computing files, overhearing conversations about clients, dumpster diving for medical and payment records. That's why you always make sure you shred anything. Don't just take it and throw it in the garbage can. Reading documents left on unattended desks or copy machines. If you're leaving your desk and you've got people's information on it, flip that information over, put that information someplace safe. Extracting data from hard drives of discarded copy machines or by any other means can be considered a security breach. Our VRPM confidentiality policy. What's the policy for protecting client confidentiality? SHIP and SMP volunteers are responsible for maintaining the confidentiality of all proprietary or privileged information to which they are exposed while serving as a volunteer, whether this information involves a member of staff, a volunteer, a beneficiary, or any other person, or involves the overall business of SHIP. We're responsible when in our roles to maintain confidentiality right there. Volunteers are to be trained on confidentiality before they get a CMS unique ID. That's why we're doing these trainings. Is if anybody you know, does not feel comfortable with counseling right now, but does want to try and learn more and work their way up to where they want a CMS unique ID to help them with their counseling, you want to discuss that with your volunteer coordinator. then you'll make sure that you have the confidentiality treatment to make, confidentiality treatment to make sure that you can get that unique ID. Volunteers are to sign a written confidentiality agreement. This is to be signed annually, and the agreement informs volunteers that a confidentiality breach is grounds for immediate dismissal, and participation in SHIP and SMP is conditioned on full compliance with this agreement. That third point there, the agreement informs that volunteers that a confidentiality breach is grounds for immediate dismissal. That is dismissal without question. If I find out, or your volunteer coordinator finds out, that you are in any way giving out anyone's confidential information intentionally, you know, if a mistake is made and that confidential information gets out, I promise that we will do everything in our power to remedy that mistake and be understanding of everything. But if anyone is discovered knowingly and willingly giving out that information, you will be dismissed immediately. I promise you that I personally will do everything I can to make sure that you're punished in any way, shape, or form, whether that's legally or anything like that, for fraud, abuse, anything like that. And that goes the same for for myself or the coordinators. If any of them were to breach that confidentiality, I would make sure that termination and immediate dismissal was first and foremost, and I would expect the same thing from them. Again, our reputation is everything, and if someone can't be trusted to maintain that confidentiality, then we will not stomach that at all. Not even a little bit. There's enough scamming and taking advantage of our older Americans that goes on already, and I won't be part of anybody contributing to that issue. Confidentiality best practices. Volunteers take steps needed to safeguard beneficiary-related information and prevent unauthorized persons from accessing PPI, PHI. Use private spaces in meetings with clients to ensure confidentiality. If you can, step away from where you're at. Try to get someplace secure that you're not easily overheard. I always tell any person who wants to discuss anything with me at an event that while I'm willing to discuss with them, I would ask that they please wait until the crowd clears out, or that they wait until we have an opportunity to step away where we can't be overheard. And in all situations, I always ask them, you know, would you be willing to call me or email me instead of talking to me right here, just to make sure that nobody overhears any of the information that we're talking about. I use computer screen covers to block PPI or PHI from unauthorized viewers. Again, if you're walking away from your desk for more than a minute or two, just put your computer on sleep, make sure nobody can get in and access that information. Store documents in the locked offices or filing cabinets. Shred written notes when no longer needed. Discuss cases with other SHIP and SMP staff in private. You know, confidentiality does not mean that you couldn't, say, talk to your fellow coordinator or talk to your volunteer coordinator if you're a volunteer, or talk to your fellow volunteer regarding someone's case. But you need to make sure that you're doing that in private, not where anyone else can hear you and overhear and get any of that information. Limit information sharing to a minimum needed to assist, train, or report. Return any original documents containing that information to clients and make copies only when necessary, and follow protocols to destroy documents containing any of that protected information. Best practices: don't send or forward emails with personal protected information to email account, Yahoo, Gmail. Don't upload personal protective information to unauthorized websites, and don't use unauthorized mobile devices to access personal protected information. Again, if this is your volunteer account where you get all of your information, do make sure that you are protecting that email account and making sure that you can avoid having any sort of personal email accounts with that information being shared on there as well. However, we do understand that if you're a volunteer, you may not be able to get a .org or .gov email through any sort of organization. So please do try to limit the personal email usage through your work. If you can, speak to that person over the phone and get that information there and keep that in a safe location. Then once you've either entered into STARS or used everything you need, do your best to shred that, destroy that in the proper fashion to make sure that it is not easily accessible to anyone at that point. Store that in a protected file or a password protected computer. Report any lost or stolen client information to your supervisor. Lock your screen anytime you step away to avoid the chance that an unauthorized individual will access it. Clear your web browser to avoid other users using the computer and accessing that protected information. Use strong passwords like passphrases for email accounts, and do lock up portable devices like laptops, cell phones, anything like that. I know that for all of our printers and laptops, we keep that in a locked drawer here in my office. Okay, I want to stop sharing the screen and check and see regarding any questions here. Okay, yes. Somebody did ask, how do we rate in regards to other agencies regarding the Likert scale that we went over shortly ago when it comes to our performance measures. I am still waiting for that information. I should have that information by the end of the month, how we've rated on overall in the nation for SHIP programs, but we are in the top 5 programs for performance measures 1 through 4 currently, based off of our performance that we had last year, which we were able to reach through client contacts just shy of 119,000 Medicare beneficiaries. So it was very impressive. It's our best, if not our best, yes, top 5 in the nation. It was our best, if not our second best year for reaching client contacts that we've ever had with the SHIP program. That is top 5 in the nation, Nancy. For performance measures 1 through 4, we're in the top 11, or we're in the top 16 at least for performance measure number 5. Now, how that will actually affect our overall ranking in there, I'm not quite sure at the moment. I'm hoping that, you know, at worst we'll be in the top 10, but we'll certainly see. I'm very excited to see where we all shake out here soon. And just as soon as I get that information, I'm going to share it with the coordinators who most certainly can share that with all of you. There was a question regarding the federal poverty limit. It looks like that I said 1615. I looked on the HHS website. They listed it as 1595. Is there a different scale determination that you use? No. Social Security uses a $20 disregard towards your annual income. That is how that 1615 figure was gained. We went over that first thing when we started this morning. So that's why it's 1615, is that the Social Security Administration has a $20 disregard to your income. I am going to show everybody just quickly here the confidentiality agreement that TennCare, excuse me, not TennCare, CMS has gotten on there regarding people who are receiving a CMS unique ID. It just says, I hereby agree and understand that I am accountable for protecting privacy and confidentiality of the information that is disclosed to me pursuant to my use of the CMS Unique ID, which has been assigned to me by the Centers for Medicare and Medicaid Services. All of this information to disclose beneficiary eligibility, claims payment specific information to me. I further understand this is to be confidential and I'm not to disclose this to use other than the CSR or participating plan representative. What I'm thinking is that I'm just going to change this to basically say I am accountable for protecting privacy and confidentiality, and should I be issued a CMS Unique ID and that's being assigned to me, that I also agree that I will maintain the same confidentiality and privacy through my use of that unique ID. That way we're not saying that everybody is going to necessarily be issued a CMS Unique ID, but for the people that are, they will also hold that high standard of privacy and confidentiality at that point, just to keep everybody in the loop. And again, I'm probably just going to stick this on the end of our already existing certification tests to try and make this all just something that can be nice and easy. Nobody has to keep up with a bunch of different paperwork. You can just make sure that once you complete your test, you also sign your confidentiality agreement. Again, you must maintain certification and retesting on an annual basis. You just have to take that recertification test once every calendar year to maintain your certification. Everyone is required to report to their volunteer coordinator each year. So you will have to turn in a report to maintain your SHIP volunteer status, as well as making sure that you take that test and recertify on an annual basis as well.
Can you hear me now?
Yes, Tina, we absolutely can.
Awesome. Let me see if I can get this little screen to go away. Does it look clear on there?
Yes, it does. I think if you'll just go to slideshow and start the slide and get it full screen, then we'll be all good.
I will do that.
There you go.
Okay. Well, good morning. Good morning. Good morning. For those of you who have stuck through it this long, you are all my heroes. That is a lot of information, like Ryan just said. I think a lot of us came into the SHIP program maybe thinking that we were confident in what we knew of Medicare, and then we sat through our training and walked away scarred and scared, but I promise it will make more sense as we go. So today we're just going to talk about counseling in general. And before I start, just a few disclaimers. I do not claim to be an expert on this. There are people that have been in this program far longer than I do, or have been, and do a much better job. But if you've ever met me, you know that I've never met a stranger and hardly ever stop talking. So I thought this would be a topic I would be comfortable to talk about. There are a lot of ways to volunteer with Tennessee SHIP. So if counseling isn't what you're most comfortable with, that's okay. We have volunteers who just come in and help with paperwork and filing. We have volunteers that prefer to do booths at the health fairs and county fairs. So whatever your niche is in Tennessee SHIP, we want to find that for you. But for those of you who do or are interested in being a counselor, being a level 3 volunteer, then hopefully these are just going to be some tips to get you started and help you feel a little more confident in what you're doing. So if you can see that little picture, when you put it like that, it makes complete sense. And I think we can all agree that that's about how much sense Medicare can make it at times. And I put on here, it's complex and frustrating to the beneficiaries, but honestly, it can be just as frustrating to us, to the folks who sit through the training. You know, we go generally every year to CMS, and they do this big training. And I was very shocked the first year that we went that the people who write the Medicare New Handbook, these presenters, were actually asking questions or being asked questions they didn't have answers to. And so they would say, let us research that and we'll get back to you at our next presentation. So I think it's safe to say we probably, none of us know it all, but together we can be a fierce team and can help beneficiaries. The other thing is, this is just one suggestion of how to counsel. My best advice, if you do want to counsel with Tennessee SHIP, is to get with your volunteer coordinator or your program coordinator and shadow that person. Find out how they do it, shadow more than one person, so that you find your best style and your comfort rather. So Ryan talked a lot about the PM, the performance measures that we have to meet, and that these are things that we are measured by. And so when we're talking to clients, when we're counseling with them, there's some information that we know we have to get in that session. So you see there's a list of required information. Some of that is just going to be things you observe. You know, race, sometimes if you're especially in person, or gender, those are things you may not necessarily have to ask. Primary language, like Ryan covered, if they're able to understand, it doesn't seem to be a barrier, then I think it would be safe to assume English could be a primary language. But there's some things that you're going to have to dig into to find out. Some of the things, method of contact and zip code, where they live, all of those things are going to be important, not only for you, but for them, to make sure that you're offering them the best programs, the best systems that are available in their area. So crazy, there's two things that aren't completely required, and that's their name and a mailing address. And by required, I mean for our STARS system. So STARS is the system that we input all of our information into, and then those reports are pulled about those performance measures. So for the entry into the system, we don't technically have to have a name or the full mailing address. We do have to have a zip code. But of course, it would make it very difficult if we didn't gather those things to then go back and follow up with that person. Some instances would be maybe if someone stopped by and talked with you about a family member and you didn't catch the full name, then in those instances, we may just use the best information that we have. So I am by trade a social worker, have been for a long time. And so as part of my social work career, I've taken lots of interns. And anytime I had an intern, this is the process we use to get them comfortable to speak to patients or clients or whatever we were going to serve at that time. The 5 W's and an H. And what we talked about, anytime we are talking with anybody or meeting with anybody, sometimes anxiety can take over. But if we just remember, it's just a conversation. At the end of the day, we're having a conversation with someone. And if through that conversation we can answer these questions, then we're going to be successful. If we can figure out who, what, when, where, why, and how, then we've actually answered those questions that are required of the STARS program, and we've gotten the information that we need to successfully serve that client. So as far as who am I counseling? Again, some of those things are going to be self-explanatory, but some of them are not. Age, for the STARS system, we just need an age range. If it's someone who is aging into Medicare, then generally we know they're going to be close to 65. For most things that we do, we're going to have a date of birth, especially if we're creating accounts for them. So that's a great way to figure out age. Race and gender are things that in person may not be difficult to acquire. Over the phone, it may be a little more uncomfortable to do. Primary language, again, you know, generally those are things that are easy for us to figure out through a conversation, but in some cases it may require a question of, you know, do you prefer to speak English or would you prefer an interpreter? Are they new to Medicare? Have they been on Medicare a while and they know the layout? They just need some help getting things squared away. Are they a recent retiree? Are they a state retiree? We covered the POMCO plan, things that are offered only to state retirees. This ties into what Ryan just covered over the HIPAA requirements. So what if the beneficiary is not available? What if the beneficiary is a nursing home resident who can no longer speak to me on the phone, or What if the family member or care coordinator of a beneficiary contacts me? What are those rules? For our program, we try to ask you to do your best, use your best judgment. Of course, we always want to maintain confidentiality and privacy. So ask questions. Are you power of attorney? Are you a trusted friend? Could I speak to the beneficiary and get permission to speak to you about their insurance? Anytime you're unsure or uncomfortable, contact someone that works within SHIP. Contact your volunteer coordinator, your program coordinator, and run it past them and say, this is who's contacted me. What do you think? The what? Now, this kind of bothers me because it should be which type of insurance, but, you know, that would mess up my program. So what type of insurance does the beneficiary currently have? Are they on original Medicare? Do they have an Advantage plan? Are they coming to me still on an employer health plan? Or maybe they're still on the marketplace. All of those things are going to kind of pattern the way we counsel to them. Are we starting at the beginning? Are we helping them to compare with what they could have? And then the most important thing on this part is what they need to bring to their appointment so that I can be most helpful to them. Nothing is more frustrating to beneficiary that they come, you know, sometimes 45 minutes or an hour away and meet with you, and all of a sudden they say, oh, you didn't tell me I needed that. So they're going to have their insurance cards, preferably, so that we can have that Medicare number. I always ask for them to bring their original Medicare card, a current and correct list of prescriptions. That can be tricky. Sometimes people will bring their actual medication bottles. That's okay. You just have to do your best with that. I've even at times contacted their pharmacy to clarify some things. If I see that they have bags and bags and bags of old medication bottles, then maybe it's time for us to say, why don't you get with your physician and get those clarified, and let's make sure that we know what medications you need to be filling. Income and asset information. So that can be kind of tricky, like Ryan said. Some people are really uncomfortable talking about money. And in just a little bit, I'll talk about the tips that I use to ask that questions. I put on there if applying for assistance, but as we're going to see, anytime we meet with someone, we always want to screen them for assistance. So at least the knowledge of that information is important. When should we meet? That's an important question because we know if we're in the annual enrollment period, that time is going to be limited. If they are aging into Medicare, what is their initial enrollment period end? If they need a plan to begin the beginning of the next month, then we know we need to meet prior to the last day of the month. If we don't complete what we're talking about in that session, when are we going to meet again? This is super important. When will any changes made go into effect? During the annual enrollment period, we know that we can make lots of changes, but they're not going to change, not go into effect until January 1st of the next year. It's important that folks realize that so they don't expect to meet with us one day and the following month have a new plan. When did we speak is actually part of the STARS requirement. On there, you have to fill out what date that you spoke or met or counseled. Where do they live? The correct zip code is really important. We know that when beneficiaries move, they have a special election period so they can make sure the plan serves their service area. So we want to make sure that we always have the correct zip code. It also plays into those counties that Ryan talked about, the rural counties. We want to make sure we get credit for those as often as possible. Sometimes we're going to have phone sessions, especially now with the world the way it is. Most of the time, we're talking over the phone. Volunteers, this can be really a difficult thing for you guys. Most of us have been given work cell phones, numbers that we don't mind to give out. Volunteers may not have that same luxury, and we don't want you to ever feel like you have to give your personal number on behalf of Tennessee SHIP. So one thing to be aware of, if you do make a phone call, you can dial *67 prior to dialing the number, and that will block your incoming number on there. I'm sorry? Oh. But keep in mind that part of the Medicare fraud and scams that we educate everyone about is phone calls. So if you do have a lot of blocked numbers coming in, you may or may not reach the beneficiary. If you do reach a voicemail and you're able to leave a voicemail, then have a plan for the call back. Most of the time, the best advice we could give you is to give the 1-800-SHIP hotline. That way you know that they're going to reach you in a timely manner. Never meet in a location you're uncomfortable with. From time to time, especially with the generation that we deal with, they'll say, oh, just come on over to my house. And honestly, that's going to be a personal preference of yours. I have done a few home visits. It's not something I do often. So what I try to say is, oh goodness, well, we may need access to a fax machine or a copier. So why don't we meet at the local library or senior center? Clearly, if your local SHIP has an office, that's also going to be an option for you. But never meet with anyone in the location you're uncomfortable with. So why? Why did they call us? Do they need help applying for assistance? Are they unsure about their current coverage? And I'll tell you, you'd be shocked at the amount of people that call and genuinely don't know what insurance they have. It's not necessarily a generational thing. It's at this point that they have so many people calling them and visiting their home and mail. And sometimes they're signed up for programs they're not even aware they're signed up for. So sometimes our questions are just going to be, can you tell me what I have? What does it cover? And it's going to be very general. Are they calling because they're a victim of fraud and abuse? That way, we definitely want to gather the information and get it to Lonnie at the Senior Medicare Patrol. Are they new to Medicare? Depending on time, if you have time, and hopefully they've called you a few months before they turn 65, then maybe suggest an attendance of the ABCs of Medicare, the general overview of Medicare, so that they can get at least a helicopter broad overview of what it is they're signing up for. So something that I'm asked often is, what is the point of SHIP? Why can't they just call 1-800-Medicare, or they can call TenCare or Connect or call Social Security? But here's the thing, we know that we do it better. We want to be the person that joins all of those phone numbers together for them. We want to be the person that can answer at least general questions over all of those programs. We always want to maintain, as Ryan mentioned, the reputation and the trustworthiness that when they call us, they can walk away and feel like they were given the correct answers and advice. Also, we save them a lot of time. If you look at that statistic, according to Google, if you call 1-800-Medicare on just a slow, regular day, your wait time is about 14 minutes. During the annual enrollment, it can increase to 1 hour, and I saw one statistic that said 3 hours. For those counselors who are trained and opt to have a unique ID issued to them, you're given a special phone number that you call to reach Medicare, and then you're going to enter that unique ID in. It's a numeric code, and then rarely do I ever wait. I'm generally immediately connected to an operator at the Medicare hotline, and we can get those questions answered. This was really beneficial when the new Medicare card came in. The new Medicare card, we had lots and lots of people who were calling and saying they hadn't gotten it yet. And so they were calling 1-800-Medicare and staying on hold forever. When we could call and Medicare could say, oh, well, they need to update their address with Social Security, or this was mailed, and then we could research and see why they didn't receive it. So it was a very quick way to build rapport and trust with a large population because we could do things so quickly. One important question on the STARS questions is, how did they hear about us? Did they have a friend that worked with us and had good care and said, hey, you should call them? Social Security is a phenomenal partner of Tennessee SHIP. They oftentimes will refer people that contact them for assistance programs or to enroll in Medicare to call SHIP. Partner agencies, our senior centers, Wesley Housing, churches, colleges, we have lots of partner agencies that will refer to us when they have people that come in or maybe have retirees. The best referral, the ones that I love to hear the most, are friends and family members, somebody that we've served and they were so well cared for and trusted that they said, hey, these folks will take care of you. How can we ensure that Tennessee SHIP is credited for the hard work that you do? Report, report, report. So this can be done in a lot of different ways. In our region, we have a couple of volunteers that actually enter their information directly into STARS. The majority just prefer to get that information to me and let me enter that into STARS for them. Either way is okay. And we want to encourage you to talk to your volunteer coordinator so that you know how she or he prefers that you report to that region so that you get the information they need. We all know how amazing Tennessee SHIP is, but as Ryan shared, those performance measures are what keep us around. So we want to ensure that not only do you get the credit for the work that you're doing, but that Tennessee SHIP gets the credit for the work that you're doing. We want everyone to know that our program is beneficial. So again, everybody has their own style and you're going to find your own way to do it. This to me is just a quick way. When I've met with somebody, I actually run through these questions in my head before I leave. Who, what, when, where, why, and how. At the end of the day, as long as you both feel respected and you both feel that the needs were met, that the questions were answered, the style is all up to you. So just a quick review. I made notes. So who am I? Who is Tennessee SHIP? Who am I counseling? That's the demographics. What do I need to assist them? Do they need to bring their insurance cards? Do they need to bring their medications? When should we meet? When did we meet? When will the changes go into effect? Where should we meet? Where did we meet? Why did the beneficiary call SHIP? Who referred them? Those are good questions. And the how is going to be, how did I help? How can I help in the future? Just a few more things that we're going to cover. So every once in a while, as you can imagine, you're dealing with folks' money and their health care. You're going to run into frustrations. So we want to talk about when someone becomes frustrated. Then we're going to talk about just best practices in general. So what if someone becomes frustrated? And I see this often when we are meeting with someone over assistance and they are just over the limits. And then you'll hear, you know, so I shouldn't have worked so hard. I shouldn't have saved. I shot my own self in the foot. And those frustrations are certainly warranted and understandable. So the one thing we don't want to do is command, you know, things saying calm down generally don't help the situation. Sometimes when we're talking with someone and they're upset, the best thing we can do is become quiet. Sometimes they just need to talk, and once they talk, they're done. So a few tips is act calm even if you're not. Take a deep breath, let them talk. Ask, how can I help you? Active listening. Repeat what you hear them saying. So I understand you're upset. You're upset because you don't qualify for assistance. Use empathy. Gosh, I would be frustrated too if I didn't qualify for the assistance I needed. Remind him that who we are, that we're SHIP, that we don't necessarily set those regulations, but we're here, we're free, we're unbiased, and we're just here to be a helpmate. Offer alternatives like, you know, maybe you'd like to take some time to think over this and then call me when you want to talk a little bit more. That can be really helpful when someone's aging into Medicare. The new persons who are new to Medicare are often shocked at the cost of Medicare. They're used to an employer plan that may or may not have been affordable. And so people come in with an assumption that Medicare is free. There's a large misguidance out there that Medicare is free. So oftentimes those folks will need some time to think about it. And that's when we go back to things like the ABCs of Medicare, where your region covers just the basics through webinar or in person or whatever the government is currently allowing to review those things so they can start being prepared for the costs that are coming. You can also say, you know what, feel free to double check this. If you want to call and talk with Social Security or want to call and talk with TennCare, that's more than fine. The last thing, and this is a personal preference and it's not for everybody, but something I use is called a blameless apology. And I'll be honest, the first time I heard of this, I was not a fan. I was a social worker at a large hospital who also was the backup for patient relations. And so when we would get calls from angry patients, I thought this will never work. And let me tell you that 10 years later, it is almost always successful. So blameless apology is simply apologizing without blaming anyone. You're not saying that you're taking fault for any part of it. It's just going back to, I'm really sorry that your income isn't included in the assistance guidelines. I'm really sorry this didn't work out. Oftentimes the beneficiary will feel heard and they feel that you care, but you're not necessarily taking the blame onto yourself or to the program. And again, if anyone were to become frustrated to the point that you start feeling uncomfortable, totally fine to end the session, let your staff member know and let us take over. I hope and pray that that would be an extraordinarily rare occurrence. It's not happened in my career here, but it could always happen. So, just be aware that we never want you to be in a position that you feel endangered or uncomfortable. We're Tennessee SHIP and we're here to help, but we also understand that you guys are volunteers and we want to be respectful of you as well. So just a few best practices, timely contact and responses. And this can be a really frustrating thing, especially out in regions like our own, that we have folks that we seem to call and call and call and can't get an answer, and then they call back and say they didn't hear from us. But we want to know that on our end, we've done everything we can do to reach that person. Always unbiased, and I put that in capital letters and I put required. That is part of why our program remains trustworthy, because when folks meet with us, they understand that we're not selling anything, that we don't represent one company or another. And so when we talk with them and we show them the plans that maybe are recommended on the Medicare website, they know that it's just the black and white information. We are not guiding them in one direction or another. Oftentimes, we have volunteers who are still working and they work in healthcare. So they may come in, myself included, with a predisposition about Advantage plans. Oh my goodness, I have seen so many people be taken advantage of with Advantage plans. But we also understand that for some, an Advantage plan may be the absolute best option. The good news is we don't have to decide that. We're here to just give them the information they need to make the best decision for themselves. So we always, always want to ensure that we're unbiased in our information and our counseling. It's always a good idea to review who we are. Whenever I am talking with someone and getting my papers ready, that's the time that I take to say, so do you know about Tennessee SHIP? Are you aware of what we offer? And that's the best time for us to say, how Tennessee SHIP came to be and what we offer versus them having to go through necessarily an insurance agent or 1-800-Medicare. We want to toot our horn a little bit about why they came to us and that was the best decision. As part of our MIPA requirements, we always want to assess for the assistance programs, MSP and LIS. One quick way and easy way that I found to do it is when I'm counseling with someone, I have those numbers written down or actually on a brochure. And I actually just pass that over to them and I say, part of our assistant or part of what we can do today is help you apply for any assistance you may qualify for. If you'll look at those numbers and let me know, is your income below that number or above it? That way, they're not necessarily having to give me a number, but they can tell me whether or not it's appropriate for us to discuss assistance any further. Most people have been very receptive to that and are very quick to say, no, I'm over that, or no, can we talk more about this? Avoid abbreviations as often as possible. So I would bet that if I took a poll right now, someone in this session has heard something along the way that they had no idea what it meant. And I've seen in the comment box, what is MIPA? What does MSP stand for? What does LIS stand for? Like any profession, we get very comfortable with the things that we do day in and day out. And we have to remember that those folks that we're meeting with aren't familiar with those things. So breaking that down, and instead of saying MSP, maybe we say Do you want to talk about some help with paying your Part B premium? Do you want to have some help in paying for your Medicare? With the LIS, maybe we say, are your medications affordable? Are you having trouble affording those? We also talk about current fraud and abuse topics as often as possible. And I tell you, I just almost always make time for this. It can be that there are flyers on the table where you are and you say, hey, as you're leaving, please take this and read this over. It could be that you're talking in front of a senior center and you say, hey, I just found out that genetics testing is happening again in your area. Please let us know if you get these phone calls. Always reminders of annual enrollment periods, of all enrollment periods, is a good idea and good practice. Especially, the closer we get to the fall, of saying, hey, remember to contact us in the fall so we can go over your benefits for the next year. I always say thank you. Thank you for trusting us with your information. Thank you for letting us have the opportunity to serve you, because we all know that there are insurance agents and other entities out there that can do what we're doing. Of course, we think we do it better, but we want to thank them for allowing us to be the servant. Always respect your own time and the time of the beneficiary. We know that when you meet with a senior citizen, sometimes we may be the only person they speak to that day. And so if time permits and you want to have a conversation about the good old days when they were growing up and when things were good, then that's more than fine. But if you're in a hurry or simply don't have the time for that conversation, it's really okay to kind of redirect them back to the topic at hand, to say, oh my goodness, wow, you've been through a lot. But now let's get back to your insurance. Most of the time that's well received and you don't come across as being rude, but you're accomplishing what you need to while still respecting the person you're speaking to. Oftentimes, this is something that I talk about over and over and over, so I don't want to be repetitive, but I do think it's important. If you don't know the answer, be honest. And there's always going to be something you may not know. Every day is a school day, and the day that we, as people, decide that we've learned it all, I think we become dangerous. So someone may come to you with a situation you've never heard of, and you may contact your ship staff member, and they may not know. And there's always going to be room for education. So be honest about that, but in your honesty, make a plan for when you're going to get the answer and get it back to them. I'm really not sure why that plan has a low rating, but let me do some research on that plan and I'm going to call you back. Most importantly, and if you don't hear anything else, know that we're a team. These are your 10 ship staff members. None of us expect you to go about this alone. We don't want you to go about this alone. And we're here. We've got your back. If you have questions, we want you to reach out to us. If you're concerned, we want you to reach out to us. This is going to be at your comfort level. And like Ryan said, 6 months to be comfortable, a year to be confident. And honestly, even if not then, that's okay too. Tennessee SHIP wants you to be here and serve in the capacity you're comfortable with. So we want to take you where you are and build you to where you want to be. And that's it. And I'm sure that it was such a wonderful conversation that there are no questions, but just in case.
Question of what is IRMA?
So IRMA is, I'm so sorry, how do I get back to you? Did I stop sharing the content?
You did. If you just go right down to the bottom, yeah. Perfect.
So IRMA, I apologize, I skipped over that in my presentation. IRMA is, and I'm going to explain it the way I do and avoid those abbreviations again. That's when Medicare says, you know what, based on your income, we may need to charge you a little bit more than we're going to charge others. So if your income exceeds this amount, then instead of paying $144 for Part B, you're going to pay a little bit more. I think that was covered in previous presentations, but it's important to review that. And I'll tell you, that's an Achilles heel for me. I forget that. And I honestly got caught in that a few months ago. I met with a soon-to-be retiree. We'd gone over everything. And she called me a few months later and said, why is my Part B premium so high? And I just had a moment of thinking, oh, wow, we didn't discuss IRMA. So I said, is your income over this amount? And she said, well, yes, it is. And so in that discussion, I said, I'm so sorry, I should have let you know that your premiums are going to be increased based on your income. And I don't know how into that we got, but the IRMA is based on your tax returns from 2 years ago. And so that can be a very big point of frustration with beneficiaries because they say, I owned a business 2 years ago and now I'm retired. I don't have that same income. And that's when we're going to be the calming force to say, okay, the good news is there's a process to appeal that. Let's work on it and see what we can do.
Yeah, perfect. And IRMA stands for income-related monthly adjustment amount. And basically, if you're an individual who filed a tax return of $86,000 or less, then that wouldn't apply to you. Or if you're filing a joint tax return, if you filed a tax return jointly of $172,000 or less, it wouldn't apply to you, but it goes up from there. And let's see here, Tina. Somebody had a question. Should we suggest that that client also discuss what has been discussed in our meeting with a trusted family member?
Oh, I think that's a great practice. Especially if you're meeting with someone and you feel uncomfortable that they understand or that they're grasping what it is that you're trying to tell them. I think that's a really good best practice to say, even if we don't say, let's let them talk to them, to say, time permitting, do we need to reschedule this? And let's bring someone in that you trust to help you make these decisions. So yeah, I think that's a great suggestion.
Yeah, I agree with Tina 100%. And oftentimes when I speak to somebody, they'll say, hey, could I grab my insert family member here, and you just explain that to them really quickly for me so they understand what you've told me and can explain it to me again in a later time if I get confused, which is always a great way, you know, especially if you've got somebody like Tina said, who is a repeat customer, for lack of a better term, and calls you fairly often. It's great to have somebody that you can explain it to so they don't call you and you explain the same thing again and again. And that picture that Tina showed at the end of her presentation is in fact all of our coordinators right there. I'm going to throw this up here really quickly here. Can everybody see my screen, or did I neglect to share that with everybody?
Not yet.
Oh, hang on, Tina. I know what it is, because you're the boss right now.
Oh.
Yeah, there we go. All right, I'm sorry. I'm taking this away from you. Uh-oh.
Hey, Ryan, I don't know if you got this question, but it looks like someone asked, is there a list of acronyms and their definitions that we could keep with the training materials?
You could absolutely reach out to your volunteer coordinator to have them send you a list of acronyms. Well, everybody, if y'all will excuse me for just 1 second, Mike. Perfect. Okay, right now we're going to cover our data system. The data system that we use is known as STARS. That is the Ship Tracking and Reporting System. Now, I've got all of these websites saved and everything in my computer, but I do want to make sure that I have it on record how if anybody ever was to lose the URL for any of these pages, that you can Google and find the URL for our data system fairly easily. So if ever you lose that URL and you do use STARS fairly often, you can find that pretty easily here. So if we just click on that, it'll take us to this page that says Ship Tracking and Reporting System, STARS. And what we want to do is log on to STARS. Now, this has got my information on here, and we will go and look in my STARS profile when I show a few things a little bit later on. But for right now, I'm going to put in another user that has a level of access about equal to what any of our volunteers will be using. Let me go ahead and get one of our call center agents put in here and get logged in. So this is what our STARS data system looks like. It can be a bit confusing from time to time when you're looking on here. There's a lot of stuff, especially on this home page, that for myself, I never even look at. I've probably used the home page, maybe I could probably count on one hand the number of times that I've done anything on the home page using STARS. Really, the most that you'll be using STARS is going to be right here under Tracking, Inbox, and Search. Now, some people may be asking, well, Ryan, how do I get use for this data system? Well, that will be up to yourself and your volunteer coordinator, depending on how many hours of training you have and what level your certification is for your training, whether you'll be able to use the STARS system or not, and to what level of access that coordinator wants to give you access to. If you are one of the volunteers that may not do a lot of keying or data entry, you probably won't use STARS at any point. If you are one of the volunteers who typically does enter that data into STARS or helps with keying or enters your own data into STARS, then you may get access. All of your volunteer coordinators can create you as one of their volunteers in STARS, and I will show everybody how that is done. For any of the coordinators, it will be a refresher for you on how to do a lot of this stuff. For any of the volunteers who currently are using STARS, it will also be a refresher on that, and I hope that you all will bear with me while I over-explain some stuff that may seem a little bit obvious to you. But for anybody new who may not have seen STARS, even if you're not going to be using STARS, I always think it's great that you can see how we're entering in all of these things that we're asking and collecting, and how we monitor our program on a monthly, daily, or annual basis. So when you go to the home screen here, you can see a lot of things. My account, where you can go in, change your password, change your preferences. Your role, you will have your role set by your volunteer coordinator. You know, most of you will be SHIP team members. That is what volunteers are. Obviously, for some of you who are going to be keying in a majority of data in for a particular region, your role may be different than that. The sign in, the help, and it will also give your name and what your role is right up here. Again, the home screen has a lot of things like the tracking inbox for beneficiary contacts you've entered, for group outreach and education. For media outreach and education, we did not spend a lot of time on media outreach and education earlier. Media outreach and education are your things like social media posts, mass mail out, you know, handing out flyers and brochures. If you were to film a TV commercial or a radio plug, anything like that, that goes under media outreach and education. Media outreach and education is sort of like planting seeds, and in order to get client contact at a later date, you're putting your information out there in the hopes that you're bringing awareness to people knowing about our program, and therefore they're going to call us or contact us or attend one of our outreaches, things that would count towards our performance measures right there. Tracking inbox, it'll show team members within your region. If you have a lot of people who are under you or anything like that, that information will be there. But for right now, we're going to focus on these next two ribbons right here. right next to home. Tracking inbox and search are going to probably be your most used functions within the STAR system. And what we're going to do is we're just going to go through each one of these from top to bottom here. And I'm going to show everybody how we enter these things, each particular one, and what all goes into that. I have a lot of people who will say, hey, Ryan, I can't remember how to quite do this or do that. Since we are recording these, this will serve as another function of how somebody can go through and look at that. If somebody is currently looking to have a little extra step-by-step of how to navigate the STAR system, there is already a recording of this that we did back in October of last year of how to use the STAR system up on our YouTube channel right now. Again, that if you just search Tennessee SHIP and S&P, you should be able to find that YouTube page. It'll just have the Tennessee flag right there in the middle of the TriStar flag. And if you click on that, you'll see not only that recording, but a lot of different trainings that we've done over the course of the last year or so will be uploaded on there. For right now, let's focus on these 4 things. Beneficiary contact, that will be our client contacts when we're calling, emailing, face-to-face, whether it be in the home or in your office, mail or fax right there. That will be how we record those. Group outreach and education, those are our presentations, our health fairs, and our enrollment events. Media outreach, that is your social media posts, your radio ads, your TV ads, flyers, anything like that. And then SHIP team member is how you enter in any volunteers or any team members in each one of your particular regions. Now, let's go with beneficiary contact. Let's say that if everybody remembers, I was talking about this made-up person who I'm going to speak to tomorrow who may have fit into multiple different categories based off of the performance measures that we looked at earlier. And so we're going to go through this beneficiary contact form and show everybody based off of what we're entering how that can count towards any particular thing. And with a lot of these, you'll see a lot of things that were screenshotted earlier that'll look a little bit familiar. So if I'm going to enter in a new beneficiary contact from the home screen, I go right next to home to tracking inbox, beneficiary contact, new beneficiary contact, and click that. And it opens up this right here. Now, for example, if I was keying in for someone else, what I would do is just open up to session conducted by and then obviously select the person who I'm keying this information in. But let's just assume that I'm keying this information in for myself as Joe. The first thing that we've got right up top here, you'll see all of these are you have to select these fields and put something in. They are required fields right here. You'll see right up top MIPA, and just as a reminder for everybody, MIPA is what we use for low-income assistance for a lot of people. So, for example, if I'm talking to this person and I'm asking them what their monthly income is or whether they're able to pay for all their medications or anything like that, then obviously I'm going to mark MIPA yes or no. I mark MIPA on nearly every client contact that I have because I always make a point to ask somebody about their income. Like Tina said earlier, we typically do try to make a point to make sure that we check with everybody that they are qualifying for financial assistance if they meet those qualifications, and that we give them the opportunity to apply for those things. So for this person, I'm just going to say, yes, I did talk to them about that, and we did discuss income-related issues. The next one is send to S&P. Was this contact with somebody regarding Medicare fraud or abuse? Did we discuss any fraud or abuse topics? Again, a lot of us do try to make sure that we make people aware of all the scams and everything going on within our area, and we do try to make sure that we remind anybody, especially if there's any sort of fraud or abuse going on that may be rampant in our area at any time, that we do speak to everybody regarding fraud or abuse. If you do speak to them about fraud or abuse and want to send that to S&P, you can say yes. If not, then no. You know, if you do send that to S&P, you'll notice once we're done with this that you'll see a number appear right here. If you put no, you will not see a number appear right here once you submit that. The SHIP reference number, we'll come back and talk about that, the same that we'll talk about this SIRS reference number after we've gotten to the bottom of this. Session conducted by, that is who the person is who contacted this person and had this client contact. Again, if I'm keying for myself, it automatically will put your profile, your name and information in there. If it is you, you can just leave that. If you're keying that in for someone else, then obviously you hit the drop down there and select who you need to. Partner organization, affiliation, zip code, or session location. What zip code did you have this contact with this person? You know, especially right now during the pandemic, I'm not doing client contacts outside of my office or prior to that, my home. So I would put whatever zip code that is. Luckily, I live, you know, just a few minutes walk from my office, so I've been able to keep both of those the same. But TCAD here is in Nashville, that is 37243. And once you enter that in, it will automatically put in a county right here. It's important to make sure that that zip code does not span a couple of counties, because if so, let me see here, I think if I enter in this one, then see that zip code spans a couple of counties. So if I were, for example, you know, in Williamson County rather than Davidson County, then I want to make sure that I do credit that as Williamson County rather than Davidson, but it will automatically fill one of those. So that is something that we as coordinators and volunteers have been able to look at in the past year or so, and make sure that we do remind everybody to make sure that you're getting that correct county that you're looking for in there. For the beneficiary's information, first name, last name, I'm just going to do Jane Doe for her first name. Well, I'll do 61. Okay. So that's just an imaginary phone number, not based off of anything, and just, well, 8675309, that one was but the area code was not made off of anything. If they are calling us, you know, it's pretty easy to get their phone number. It usually appears on the telephone if you do not have a phone with caller ID. Typically people are willing to give you their phone number, so you can contact them back and offer them any sort of further assistance. If they do not want to give you their phone number, or you cannot view their phone number, you do not have to put a phone number in right here. Again, I do try to get a phone number when possible. If that person were to call me back, it just gives me more options to be able to get back a hold of this person if need be. Email is another option, especially for people who email me with a lot of questions or anything. We may never exchange a phone number there, but if I've got their email number, I can know, hey, if I need to send something to this person, then I always can be able to find their email address from their record. Right here, representative information. Say, for example, someone called you and they said, hey, I'm calling for my mother, Jane Doe, then you can make sure and say, okay, well, you know, the daughter of Jane Doe, Jessie Doe, she's calling for her mother, Jane Doe, and I'm going to put her information there. So then if myself or one of the other coordinators or one of the volunteers were to get a call from that person too, and they tried to find this person, they could go, oh, okay, this case was regarding Jane Doe, but I should contact her daughter, Jessie Doe, in this situation right here. And you would put all the same information. Again, I would prefer, if you do not know a person's name, that you would put a Jane Doe or a John Doe, something like that, so we can at least be able to confirm the fact that, yes, this was somebody that we spoke to, that I just didn't get their name, as opposed to somebody I forgot to put a name in or anything like that. Putting something like that in, you know, even if I were to go and search Jane Doe's or John Doe's, at least that is a confirmation of the fact that it was not a mistake. It was an intentional thing that you left out the name for a reason. Past that, you've got the state of beneficiary residence. We should not be speaking to anyone outside of Tennessee about themselves. We do have people who call from other states regarding their loved one within the state of Tennessee, but everyone who we should be assisting should be residents of Tennessee, or at least should be receiving their care within Tennessee. I know that for areas like Johnson City or Memphis or the Chattanooga region, you may have people that, you know, live within one state but get all their care in Tennessee, something like that. And we obviously want to make sure that we are putting their correct zip code and county, but we do want to make sure that we in some way are trying to make that very clear to people, is if they, for example, are wanting information for a zip code within Tennessee because that's where they get all of their health care, then possibly put you know, the zip code for what they're interested in this region, and put their residential you know, address and zip code down in the notes there, to make sure that we are making sure that we're covering the state of Tennessee and we're not assisting people outside of our state. There are ships for every single state, and obviously if somebody from, you know, Kentucky or Mississippi or Alabama or Georgia or Florida or Virginia or North or South Carolina, if anybody calls us and wants assistance, we want to absolutely direct them to their ship in their state for the plans within that particular state. But once you do that, you can put that zip code in. Again, make sure that that's not a zip code that spans multiple counties, because if so, you'll need to make sure that you've got the correct county as well. Date of contact, again, you want to make sure if, you know, what day you spoke to them. So if you're going back and trying to keep record of that, you can make sure that, hey, I'm doing everything I can to make sure that I'm keeping record of the correct time and place in which I contacted this person. This is especially useful because, you know, Tena mentioned it earlier, that we have people who, you know, will call us back quite a few times, and especially in this day and age with us trying to return phone calls, it's one of the things that happens a lot of time is that we'll try to call somebody who's tried to get in contact with us. We'll miss them for any particular reason, and we'll either be hit with that this person does not have a voicemail, or their voicemail is full, which is, at least I would probably guess, the top 3 most frustrating things that any of the coordinators would tell you when it comes to trying to carry out the job. Volunteers would tell you the same thing, I'm sure. Because what happens is that person will keep calling back into the hotline, and they will say, this is my 3rd, 4th, or 5th call, and not mention the fact that the coordinator has been calling back 6, 7, 8, 9, 10 times and has been trying to contact them, they just don't have a way to leave a number to let that person know, hey, I've been calling you, I've been trying to contact you. So if you're keeping proper record of when you're speaking to this person, we can get a better idea of the whole picture of your dealings with this particular individual. Now, how did this person learn about SHIP? There's a whole drop-down menu right here, anything from CMS outreach, SHIP mailing, SHIP media, presentations, your health and drug plan, a friend or a relative, that's a popular one, previous contact, partner agency, Social Security, they give out our information all the time, state Medicaid agency, TennCare gives out our information for better or worse, state SHIP website, 1-800-MEDICARE, other or not collected. I know that for myself, the state SHIP website is primarily what I end up marking because I get a lot of people contacting me through our email address or through electronic contacts, but I would bet that partner, friend, or partner agency friend or previous contact would be a lot of most everybody else's. Your method of contact, email, face-to-face at home or facility, or at your counseling location or event site, phone call, postal mail, and web-based. I think I saw a question come in out of the corner of my eye about how to mark TriCore calls that come in. I would mark those as a partner agency right there, and that's simply because we do not have SHIP hotline on here, so I would just put partner agency right there. But again, you could make a case for it to be, previous contact or anything like that. Again, method of contact, we've got email, face-to-face, phone call, postal mail or fax, web-based. What the age group is, remember we talked about performance measure 3 is under 65 and disabled. Again, this is where one of those qualifiers for that counting is right here. What's their age? We do not have specific ages. We have age ranges. So, for example, anybody who feels uncomfortable giving out their particular age, you can say, well, I don't need to know, what your specific age is. Would you mind letting me know if you're older than 65 but younger than 75, or if you're older than 85, anything like that. But again, if anybody is being really tough and just doesn't want to give us that information, not collected is an option, but I do want that to be our last resort. With beneficiary gender, we've got male, female, other, or not collected. In terms of asking somebody what their gender is, that can be an uncomfortable question to ask too. I know that there's a lot of hesitation not to misgender anybody or anything like that or offend anyone of any sort. However, just from my experience, I've always just taken the direct approach and asked them what their gender is or what they prefer for me to call them, and that seems to be a much more agreeable way rather than me calling them by something that they do not wish to be called through the whole process of trying to give them assistance. And it's worked out for me, but if you do feel uncomfortable or anything like that, not collected is on there. Again, I would like that to be our last resort, but I understand if that has to be what you put on there. And that goes the same thing for race. With making a decision on what we believe someone's race or ethnicity to be, when you are not directly asking them, that again is a very tricky situation. So, I would absolutely like for everybody to ask that. If you would please do that. I always let people know that's not based off. We do not base that off of anything. We solely like to track and see how well we're able to serve all of our different populations within the state. Obviously, if we're underserving one of our beneficiary races in the state, we want to make sure that we do everything we can to serve that population better. But if anybody does feel uncomfortable doing that, not collected is right here, and you can most certainly do that at that point. English is a primary language. Again, we read those qualifications earlier, that if somebody identifies as, yes, English is my second language, or if you can reasonably conclude that that person does not or struggles with reading, writing, or speaking English, or that English is not their first language, then you could mark yes or no dependent on that. Beneficiary monthly income at or above 150% of the federal poverty limit, below 150% of the federal poverty limit or not collected, receiving or applying for Social Security disability or Medicare disability. Again, if somebody is on Medicare due to being on Social Security disability benefits for at least 24 months, then that information would be right there. You could mark yes or no. Again, typically, a good thing to remember too is that for somebody who is below the age of 65, so 64 or younger, almost always is that going to be marked yes. For somebody who is about to be 65, so say they're going to turn 65 in the next 2 months, we do all have a different way that we handle that. Some coordinators will put, yes, we'll go ahead and give them credit that they're 65, you know, and there are other coordinators who say, nope, they're 64, but then when I put 64, I also mark no, they're not getting Medicare due to disability at that point. Once we mark all of this information, we get down to topics discussed. Again, we looked at a bunch of these earlier, but these are just a collection of all the topics that we do talk about with people when we are assisting them through Medicare topics here. Again, original Medicare, that's parts A and B. We've got a bunch of information right down here, anything from appeals and grievances to eligibility, to benefits explanation, to fraud and abuse, quality of care, enrollment. The same thing for Medigap, benefit explanation, eligibility, fraud and abuse, marketing, sales, complaints and issues, plan non-renewal, plan comparison, those sorts of things. Medicare Advantage, all that same information. Medicare Part D, the same information, appeals, grievances. I do find that, for example, if I'm talking to somebody and they're just wanting some information about Medicare, then I would say, okay, well, I've screened you to make sure that you're eligible for Medicare. If you're asking me to explain a little bit about Medicare, there's benefit explanation. You know, if you ask me about, well, what are all the parts of Medicare, then obviously I go, okay, well, I've talked to you about Medicare Advantage. I did talk to you about Medigap policies. I screened you to make sure that you had all the different parts of Medicare that would qualify you to be able to take these things. Same thing with Part D. Talk to them about that. I also talked to them about low-income subsidy. So I would say, hey, are you know, if your income is below this level, then you may qualify for some form of financial assistance. Do you have an income below that? And if they tell me, no, my income's above that, then I say, okay, well, just eligibility then. If they say, yes, my income is below that, then maybe I explain a little bit more about what benefits they could apply for and could qualify for. There's things like other prescription assistance, manufacturer programs, which I don't know how much we went into when it came to the drug plans. I believe that those were discussed a little bit, but those are the plans that drug manufacturers offer assistance programs. We usually save those for after we determine that somebody is not eligible for extra help. Then we would send them some of those drug manufacturer programs at that point. Military drug benefits, state pharmaceutical assistance programs, union employer plans, Medicaid. Again, if I'm screening somebody for financial assistance, that goes right there for eligibility and screening. If I have to explain to them, you know, what everything entails, I would put that. Other insurance, things like active employer health benefits, COBRA, Indian Health Services, long-term care insurance, other health insurance, retiree employer health benefits, TRICARE for life, VA benefits. And then we've got other additional topics, things like your ambulance, your dental, vision, hearing, which is a big thing that we always do discuss. You know, dental, vision, and hearing, Medicare view those as comfort items not necessary to prolong your life. So Medicare does not typically cover those, at least under original Medicare, unless they're associated with some sort of disease or condition. Any coordinator will tell you that they disagree with that they can think of a million reasons why you would need your eyes, ears, and to be able to, you know, stay out of as much trouble as possible. We have a nutrition problem in our older American population, and the less teeth you have, the harder it is to maintain proper nutrition. So you'll deal with that a lot. DEMPOS, that's durable medical equipment right there. Dual demonstration, home health care, hospice, hospital, getting a new Medicare card, new to Medicare, preventative benefits, skilled nursing facilities. There's, you know, quite a bit of topics that we do discuss in here. And then time spent. How long did you talk to this person? Now, you can enter that in hours. You can enter it in minutes. I always just go with minutes since it translates just straight to minutes anyway. But say I talked to them for, you know, an hour and a half. You can put, well, I didn't hit the decimal there. No, you cannot put decimals right there. So if I said an hour and a half, I did 1 hour, 30 minutes. It's just going to translate into that. If you said just one hour, then it obviously would leave at 60. Or you could just say, well, I talked to them for an hour and a half. That's 90 minutes. And that's how long I spoke to them. Now, we used to have a lot of different statuses. But here I'll break it down. There's only two statuses, in progress or completed. The easiest way to explain in progress or completed is if I expected that the information that I've given this person during this contact is going to lead to them contacting me back again in the immediate future, not a year from now, but say in the next month or so, or the next 3 months, if I said, hey, well, you told me that you were going to be eligible for Medicare in November. You're a little bit too early. Why don't you contact me back in July or August? Then, you know, I would say, okay, well, that's in progress. They're going to contact me back here shortly. But if, for example, I did a comparison for someone and I didn't expect for them to contact me back anytime soon, then I would put completed. The same thing as if I had enrolled somebody into a plan, then the natural expectation is that's the end of our interactions. Or if I talked to somebody, explained everything, and I said, hey, you know, we can do comparisons, and they said, well, can't I just do all of that myself? I could say, yes, absolutely. And they say, well, I'm just going to do that then. Then I would put that as completed because I don't have any expectation based off of what they're telling me that they're going to contact me again. So if you expect them to contact you back, put in progress. If you don't, put completed. We've got these special use fields right here. These special use fields I won't focus on too much, but I'll go ahead and just mention that if you were to enroll somebody into a plan, what we do is we try to keep track of their cost outcomes. You may also refer to these as cost savings as well. That's basically, I'm sorry, I'm getting a lot of notifications right there. People may refer to those as cost savings. What we'll do is if I was trying to help somebody switch from one plan to another, I would mark, you know, what their original plan costs. So let's just say this original plan cost them $1,000 a month, and I'm trying to help them find a plan that's going to cost them a little bit less money. When I do that comparison and help them select a plan, once they've selected that plan and gotten enrolled into it, they would record how much that annual total for that plan is going to be for the remainder of the year for next year. So let's say that this is in November of this year, this person is paid $1,000 or expects to pay $1,000 next year on their current plan, and we're helping them find a plan that's a little bit less money. We find a plan that's only going to cost them $500 a month. We would record that in there. However, we would also record it if somebody said, well, I'm on Cigna right now, but you know, my doctor tells me that I should go with Blue Cross and Blue Shield. I'm at Vanderbilt, and everybody tells me Blue Cross and Blue Shield is the best. And they say, I don't care. I just want to be enrolled into that plan. Now, the reason why I would not recommend that is that Vanderbilt does not accept any Blue Cross and Blue Shield Medicare Advantage plans, if anybody is unaware. So this plan is going to be more expensive because they're not accepting any of those. None of the doctors there at Vanderbilt accept any Blue Cross and Blue Shield Medicare Advantage plans. So that ends up being more expensive. Even if it's more expensive, we still are going to mark that. That's why we use the term cost outcomes as opposed to cost savings, because we don't only record it if we save money. We record it regardless of whether it's more money or less money. But we do try to keep track of that so we can keep a record of how much money we have saved people over the course of any given year. And we do typically save people money overall. We do not typically see. We save people a considerable amount of money each year. And we use these other fields for particular things if Booz Allen Hamilton or ACL, Booz Allen Hamilton is the administrator for this database, or if ACL was to ask us to record things, like, for example, if we were to talk to anybody regarding COVID-19 information, we were to record that in field 3 for COVID. You know, any of the other fields could be used for multiple things. The notes field can be used right here to record any sort of information right there. You can attach files. I'm one of the people in the state, and I don't know, you know, any of your coordinators can tell you whether they do this or not. I have no paper files on anybody that I assist. Everyone is electronic and it's saved in our database that I assist. And I upload and attach all of their documents into each of their files when I speak to them. So I've got everyone's files, so when I browse and find somebody who I've spoken to, I can see the copy of their comparison, the copy of their enrollment. If they sent me a prescription drug plan worksheet, it's saved on here for each contact with each person. But if you want to upload those things, that's where you would do so, is right here at the bottom of that. And then once you've completed all of this, you would hit save. And then once you save, depending on if you did mark yes to S&P, that would be in regards to fraud or abuse. Lonnie gave that presentation yesterday regarding fraud and abuse. Then if you had marked yes, you would see a SIRS reference number pop up right here. Regardless of whether you mark yes or no to S&P, a SHIP reference number will come up right here. That is the best way to ensure that all this information that you just entered saved into the database. I don't experience, you know, big data glitches in the data system as much as anymore. Any of the coordinators will tell you we had a very steep learning period and performance period when all of this was first being implemented. However, now everything seems to be pretty leveled out and pretty successful. So when you submit one of these, typically it will go very quickly, and you'll see your SHIP reference number and your SIRS if you had included S&P in there too. And you'll know, once you see that SIRS reference number, this contact has been accepted, and then you could either go and do a new beneficiary contact or move on past that point. Now, that's beneficiary contact, so that's the people that we talk to face-to-face, on the phone, email, mail, or fax. For outreach, we're going to go right here to Group Outreach and Education. These are our presentations, our health fairs, and our enrollment events. We go right under tracking inbox yet again, right down past beneficiary contact to new group outreach and education. Once we get there, you'll see a lot of stuff looks pretty similar. Again, MIPA is right up top. That's your low income. If you're doing a, doing an event at a commodity center or a food pantry or something like that, where you typically find that it's more of a low income assistance presentation or event or anything like that, then you can mark yes or no. I do make sure that what my audience is. If I go to if I go and do a presentation at, say, one of the private high schools in the Nashville area, typically that I'm not appealing to a MIPA audience. But if I was to go to one of those rural county senior centers, typically I'm appealing to a more rural, low-income population than the former right there. Again, S&P right here, if you're discussing fraud and abuse, make sure that you mark yes to S&P, so that sends right over to SIRS for Lonnie there.
Yes, please.
Yeah, see? Because Lonnie does that for us as well. She always makes sure that she puts in stuff when she mentions ship stuff. So you want to make sure that we get credit not only for all your ship work, but all your S&P work as well. Session conducted by, again, it's going to automatically set to you if you're logged in on your own account. If you're keying this in for someone else, then you would obviously just go select that person right there. Partner organization affiliation, time spent in hours. Again, they're going to put that into minutes. So however you do that, you can just make that call and it's going to put that into minutes right there. The title of interaction. So, again, there are certain things like the ABCs of Medicare that we have agreed upon as a program, that this is how we're going to put things in on our data system. For example, I mentioned earlier that, some of the regions may call the ABCs of Medicare, Medicare 101, or Ready, Set, Go Medicare, or Intro to Medicare, or anything on their flyers. But when we put that into STARS, we all put the same thing, the ABCs of Medicare. The reason for that is that when ACL or any of our funders or any of the people that administer our program, when they look at that, they don't question, well, what differentiates Medicare 101 from ABCs of Medicare, and what differentiates that from this and that? And so in order to cut down on any sort of confusion for people who may not understand that these are all just different names for the same thing, we just put a unified thing right there. And I can absolutely make sure at some point in the future that we all go over as a big group what those particular things are for anybody who is keying into STARS fairly regularly. But for the purposes of just right now, we're just going to move on past that. So we'll just say web volunteer training. Now, what we're doing now is what type of event? Again, it's the 3 events. Is it a booth or exhibit? That's at a health fair, a senior fair, or community event. County fair also would be included in that. If you set up a table at the local barbecue fest, or the Apple Fair, if you're in Unicoi County, Tennessee, or anything like that, then you would put booth or exhibit right there. Enrollment events, we usually typically hold those enrollment events during open enrollment of each year, or I should say the annual enrollment period from October the 15th through December the 7th, or the open enrollment period for Medicare Advantage, January the 1st through March the 31st. However, I know that a lot of the regions also set up some of those enrollment events at different points throughout the year. So it may be that you're holding an enrollment event in July. I know that maybe about 4 or 5 years ago, one of the big Medicare Advantage companies in the Northeast Tennessee area, in the Johnson City area, they shut down in the middle of the year, and we had about 10 to 20,000 people who had a special enrollment period through the middle of the year, and so we had to hold a whole new round of open enrollment events in about June or July of that particular year. So we ended up doing double the enrollment events that we typically did in any given year. So it may be that you're holding that enrollment event in the summer or anything like that. Or as an interactive presentation to the public. Note that this says in-person, video conference, web-based event, or teleconference. So if I was presenting to just the community and this wasn't a volunteer training, then this would be an example of something that could count towards outreach and education within our program. Performance measure number 2, if everybody remembers from this morning. Once you've selected what the correct thing is, then you get to number of attendees. Again, you know, I can look, you know, on the attendee list for this WebEx that I've got right now and see exactly how many people are attending right now. I can look at the sign-in sheet for if I'm giving a presentation. If I'm doing a presentation in a small senior center, I may be able to just eyeball and count how many people are attending. But if I was, for example, going to a large college where I was going to be in an auditorium giving a presentation for a group of teachers or family members of students or family members of teachers or anything like that, then I could look on a sign-in sheet or something like that to get that number of attendees. If I was at an enrollment event, obviously the amount of people that you assist will give you the number of attendees for that. But if you're at a health fair booth, a good general estimation will do. You do not have to worry yourself to death on the specifics of whether it was 600 or 650 people. However, if you tell me, oh yeah, I saw 60,000 people, then obviously there would be a question of that as opposed to a more realistic number like that. There was probably, I'd say, about 2,000 people who walked past my table last night at my county fair or something like that. So don't get too bogged down in the specifics, but make it a good general estimation there. Start date of activity and end date of activity. You know, for events that may span a couple of days where, for example, we had a conference of all of the judges in the state of Tennessee at one of the big hotels one time where we went and we set up that table, and while we didn't stay all afternoon and all night while there was a bunch of things, we left the table up overnight and allowed all of those people to be able to go in, collect information and everything overnight. So that may be an example where the end date and the start date do not fall on the same day. But most of the time, your start date of activity and end date of activity are on the same date. Things like the zip code of your event, please do make sure that you are putting the correct zip code in and make sure the county matches up to what you're wanting it to be. Make sure that you're getting the correct county right there. Your event contact first name, again, that's not a required field, but say I did an event that I felt like was really successful and it's my first time doing the event, then I would be able to check back in a couple of months and be able to say, hey, who was it that I talked to about getting invited to that event? Let me call them again and see if they plan on doing anything like that again. And that's a good way to build partnerships and to build counseling sites too, through coming back to the people who you found to be location successful and event successful. Your intended audience, the people that you expect that you're speaking to right here, are right here, things like beneficiaries, employer-related groups, family members or caregivers, limited English proficiency, Medicare pre-enrollees, partner organizations, people with disabilities, rural beneficiaries, or other. Your target group, American Indian, Alaskan Native, Asian, Black or African American, disabled, Hispanic, Latino, languages other than English, low income, Native Hawaiian, rural, or not available or not collected. And then topics discussed as well. You'll see a lot of topics that are in your normal Medicare enrollment event, or excuse me, not enrollment event, your normal client contact form that we just went over prior to this. Things like duals demonstration, Medicaid, Medicare Advantage, fraud and abuse, Part D, Medicare savings programs, Medigap's, anything like that. Again, in our special use fields, I know that some people may use special use field 4 for, say, an address or something like that, how they track that. We don't have the before and after that was on the client contact form because, again, this is not how we would fill out a client contact form right here. But we would put the notes in if we wanted to attach the flyer or anything like that just for record. We could browse and attach that file right there. And then obviously hit save again and we would see ship reference number for certain. And then obviously if you would hit yes to S&P, you would also see a SIRS reference number right there. And just to be perfectly clear, if I do this outreach event right here, this is what I'm turning in for the event. If I were to have a one-on-one counseling session with anybody while also carrying out this event, while I would submit this, I would do all of those individual contacts through the new beneficiary contact form right there, which you can have both in the same session. Typically, I have somewhere between probably 5 and 15 people that I usually expect to come back from an outreach event having talked to, because typically there's at least a few people that want to talk about specific things regarding their Medicare that they're receiving. Now, just really quickly, we went through your client contact form. That's your one-on-one contact. We did group outreach where you're making presentations or holding events or anything like that. We're going to touch on media outreach really quickly too. Just because they don't count towards our performance measures doesn't mean that they're not a good tactic for helping to bolster those performance measures. As if anyone remembers Sydney, who used to be the volunteer coordinator, she always said that they were tools that we use en route towards reaching our performance measures. But you'll see that with those, a lot of that same information is the same. You've got, is it NIPA? Should we send it to S&P? Who conducted it? How long were you there? What's the title of the interaction? You'll see what type of media is it? Is it a billboard? Is it email, magazine, newsletter, newspaper, radio, social media, television, website, or other? You can most certainly put other if you so choose right there. Estimated number of people reached. You know, for example, if I sent out a mail out, my estimated number of people reached is how many ever, you know, brochure, you know, postcards or anything like that I sent out. If I posted something on social media, my estimated number of people reached. You can get that through analytics on your page. For billboard, you know, you typically look at what's the population in my city and what percentage of that population is of you know, driving age, and have to make a relative guess when it comes to something like a billboard or something like that. For television, you can look at what the viewership is for that particular segment at time in that. I know that when we had filmed and had our commercial in Johnson City, the news channel was always very good at giving us what the ratings and viewership was from from Nelson and giving us a good idea of how many people we were able to reach through that. Geographic coverage, did this go to a county or multiple counties? Did it go to multiple states? Did it go national, regional, statewide to a particular zip code? You can really get a specific, how far of reach did this go? Obviously, if it's something like a social media post, then you could rationalize putting national right there, because anyone in the country could view, or in the world for that matter, could view that particular Facebook or Twitter or Instagram or something like that page. But for something like a mail out or a billboard, you're going to probably put something like county or counties there, since it's only really going to be the people who interact with that billboard regularly. Start date and end date of activity. A billboard might be something like this too, where if I'm sticking it up for 3 weeks, then there's a start date and an end date. For something like a mail out, it's probably, about a week span of from when you send it out to when you expect somebody to receive it. The state of event, the county of event, the zip code, all of that's the same. Intended audiences are all the same. Beneficiary, employer-related groups. Target beneficiary group is the same as well. And then so are the topics discussed. All of that information matches up to what we looked at in the outreach as well. Special use field, if you want to attach something or put some notes in there, you most certainly can. Now, for the last step of the tracking inbox, we see ship team member right here on the bottom. This is, again, how we add new volunteers or new team members. That's the term that that's the term that STARS likes to use. I always kind of expected them to do something a little bit cheesier, since we're ship and our logo is a boat. I always kind of expected it to be something nautical themed, but team member is right here. That's what they have deemed it. So that's what we look at right here. And you can see that the only person that this person can view is themselves. This person does not have the ability to add team members. Since they are a team member themselves, they will not be able to add that. I will switch over to my role to show everybody that. I'm not certain whether I'll be able to sign on to 2 profiles at the same time, but we'll certainly see. Okay, so if I go in here and I go down to team member, then I can add new ship team member. And all of your coordinators have the access to be able to add team members as well, but just for the information of what information you would need to provide to your coordinator to have access to the STAR system, if you are in fact intending to enter that data yourself or help them with data entry, which, just for reference, all of your coordinators will work with you to find what you enjoy doing. If you're a person that does not enjoy counseling and wants to be someone who can enter in data and help them with maintaining the timeliness of when they need their data in, I guarantee you that your coordinator has a big time use for you and will be very appreciative of that. Or if you want to be somebody who doesn't do as much data entry and prefers to do the counseling and send those reports in, as long as you're getting those in on time, they would appreciate that. If you want to be someone who only does presentations and outreach, a lot of your coordinators will work with you to find what works best for you. But if you are somebody who is going to be using the data system, then this is the sort of information that they will need to collect from you to make sure that you can have access to the system. That being your first name. You don't have to have a middle initial. If you want to add it, go for it. Your last name. If you've got a nickname, you can put that in there. Your primary phone number. Again, if for example, they just wanted to put the area agency that they're with, or if you work for another agency and you are putting that. However, they're going to use that to get in contact with you. That's the phone number that I suggest putting that on right there. If you want to put an extension on there, a secondary number, or an email address, especially if you want access to this, you'll need to provide an email address, because what will happen is that either they will send that, either they will submit you, or if a coordinator cannot do that at any particular time, it would fall on myself, Lori, or Alinka to help them with getting anybody entered. That will be, you will first and foremost go through them. They will be the people who are entering you. But we do work as a team here, and if someone's unable to do that at any particular time, we all help out with each other. An email address, what will happen is once they send that, they will send your credentials to that email address. You'll be able to have your username, and it will send you a temporary password, which you can go in and change to whichever password you prefer. Address, city, zip code. Address and city are not required. Zip code is. If you are not doing calls from your home, if you're helping them from within the AAAD or anything like that, you can just put the zip code of the AAAD. That's perfectly fine. Again, state, territory, county, make sure that county is correct as well. What was the start date of when you became a volunteer? If you don't remember the particular date, try to get as close as you can. For any of the volunteers that really just can't seem to remember, I always just suggest going back to, you know, as close as you can remember. If you can just remember a year, just do January the 1st of that year, and we'll go from there, anything like that. If unfortunately you do choose to leave us at any point, that person can go in and also put in an end date for you as well. What your status is. If you're an active volunteer, that means that you are attending the trainings. You're turning in reports to your coordinator, and you're keeping your certification maintained. Inactive, we haven't received reports from you in a while, and you haven't been attending any trainings, and you are not maintaining your certification, you will be put as inactive. And then after a few months of that, or if you do choose to tell us, hey, I just, you know, I really can't do this anymore. I've got, you know, family needs, or, you know, I'm in need to really just stop doing this, then we could put you as retired and go from there. Partner organization affiliation. Now, this right here is a little bit confusing because I've got access to everyone, but if you're in a particular region, your coordinator will only see their region right there and will be able just to select you right there. For anybody that doesn't quite fit into any of the AAADs or anything like that, they can always be marked as Tennessee SHIP as well. Paid status. SHIP paid, if you are a staff member who is paid from the SHIP or MIPA grants, then you are SHIP paid. If you are somebody who works within one of the organizations where your SHIP coordinators work and are being paid to do that work through the course of your everyday work, you're also accomplishing SHIP work while you're performing your day-to-day duties. You'll be in kind right there. And if you're a true volunteer who's just doing this because you really enjoy understanding Medicare yourself and you have a desire to just try and help people, then you're going to be just a volunteer right there. Again, your race or ethnicity, all of that's the same. We typically do have a lot of questions about what about this particular race or this or that or this or that. We've gone to bat. I guarantee you that at least one of the coordinators has gone to bat for, you know, probably 18, 19, maybe even as many as 30 different other races or ethnicities that we've asked Booz Allen Hamilton to add into there. They have refused that. They want to keep that, you know, like this with not as many options in there. you know, somebody may ask, like, well, what about, Indian or anything like that? They expect you to put something, or Middle Eastern or anything like that. They expect you to put Asian for something like that, or try to find the closest race or ethnicity from that. Again, we probably will try to convince them to change that at some point in the future, regardless. But how much success we have on that, I won't be able to tell you. But if you just prefer to not state that, you can always put not collected. That's perfectly fine. Date of birth, please do give us a date of birth. For anybody who feels uncomfortable putting your date of birth on here, I always, there is no other as an option for race right there. For anybody that does feel uncomfortable putting a date of birth, I always, we'll just put 1/1/1965 as my go-to birth date of choice. If somebody, doesn't feel comfortable or refuses to give me a date of birth, that's just easy for me to remember. January the 1st of the, 1965, at 65, you become Medicare eligible. So it's an easy thing for me to remember, and remember why I would have put it like that if they ever go like, why is my date of birth wrong? For gender, again, you can put male, female, other, not collected. If you don't feel comfortable, giving your gender or anything like that, you can always put other, not collected, whatever you prefer. Primary language, English, Chinese, Korean, Russian, Spanish, Vietnamese, and other. This is another thing that we've asked Booz Allen Hamilton to include more languages on here too. They have turned us down on that as well. Now, based off of how much you're going to be doing within any agency or anything like that, a lot of people will be SHIP team members. Most of our coordinators are SHIP site managers, meaning that they can view all of the people within their region. They may give you SHIP site staff where you can help them create team members and have just a little bit more access than team members, but not as much access as them. Or if you're the main data entry person for someone, you may also be a SHIP site manager as well. And then your SHIP e-file ID. This is where we would click yes to send you your login credentials, where you'd be able to have your username, have your password, and get logged in through there. If for any reason we needed to take that away, it's as simple as me clicking yes, and then it shuts down your account at that point right there. And then I mentioned really earlier today about the programs. If you're trained in everything, we typically do mark you as working with all three of these programs. If for any reason you didn't receive training in one of these, or you were not going to be, doing any sort of MIPA work, but you were going to be doing SHIP and SMP, then we could be marked that. But for the vast majority, everybody typically is marked with all three of those, because typically everybody, is knowledgeable and gets trained in all of the three things. Even if they don't deal with it every day, they still have the capability of being able to speak to somebody regarding that, or at least being able to refer them to the correct person who can help them with that. If you are one of the people who is counseling fairly often and your coordinator wants you to have a unique ID number, then we would just click yes and to send you that and set your status as active, and you'd be able to do that. And then of course, if any of the coordinators want to attach your application, your background check, your VRPM, any update on your certification testing, updates on your training, want to get all of that attached and put in your file here online, they can most certainly do that in there as well. And that covers all of the tracking inbox right there. That's entering new people right here. Now, when it comes to trying to find people, what you can do is go right here to search, and you've got a couple of different options. The way that I typically do it, and the coordinators can show you if they've got a particular way that they like to do it that's better, that they feel works better, that they understand better, they can most certainly do that. I just try to do it the simplest way that I possibly know how to do it and go from there. What I do if I'm trying to search for anything is I always use the standard search in any situation. I very rarely do an advanced search. I know that a lot of the coordinators do advanced searches, and if they feel like that they can do that better and they want to show you how to do those advanced searches a little bit more, they most certainly can show you that. I feel that those advanced searches are not reliable and don't show enough information and leave out information. Just from me using it for the past year and a half, I've noticed a lot of inconsistencies with those advanced searches. So I personally do not use those. I'm not saying any of them are wrong. That's just my particular view on that, and I just do not do the advanced searches. Booz Allen Hamilton has expressed that they feel that they finally got those advanced searches to a place that they want them to be at. I find them to be a little lacking still, but again, I find them to be a little lacking in a few things. So, you know, the whole site is not perfect, and it will never be perfect, because my version of perfect and what I would look for would not be the same as everybody else's. So just in terms of searches, let's just go right here. Again, we go right past tracking inbox to search. And if I were trying to search somebody who I had spoken to within the past couple months, I would hit standard search. And then it asks you, is this a beneficiary contact or is this an additional session? Now, I will show everybody additional sessions here shortly, but let me just go with beneficiary contact right here. Now, the best way to do this. If I were to want to look for somebody who I've spoken to recently and wanted to find some information, and say I was looking for someone who I'd spoken with recently or within the last year sometime, and was really trying to get their information, what I could do is I've got a lot of different options. I can search by a lot of different ways. If I want to just search by anybody who I've assisted, I could go right here to session conducted by and put me. If I wanted to search by date, I could go to date of contact, and if I knew the specific date, I could put that in there. Or if I wanted a couple of different options, I could do before a particular date, after a particular date, between a specific amount of time. So if I wanted to look for, say, well, I know that I talked to him sometime between June of 2018 and let's just do January of 2018, and sometime before, oops, I was doing years, and December the 31st of 2019. I know I talked to him sometime within the last 2 years, and I can't really remember who I spoke to, but I believe that their last name was Essery. No, turns out that I didn't. So I can always, if I enter anything in, I can always put remember criteria. Okay, right here. Now, this is someone who Sydney had assisted. this is actually my great-grandmother who has now since passed away. Therefore, none of this information is usable anymore, and plus there's no identifying information on here. But this is my great-grandmother who Sydney had apparently assisted as well as myself. Sydney ended up assisting her, or I reckon it was one of my grandparents actually, on September the 25th of 2018. Now, I found them say that she had called back and wanted to speak again. What you can do is if you pull up that file, once you find somebody and you click on them, you pull up their beneficiary contact from that date. If you go right here next to where it says beneficiary contact, to where it says SHIP beneficiary additional sessions, see there it is, you can see any additional sessions that were spent on that person, or you can add an additional session to say, this is the same person, this is just a new time that I spoke to them. And then it has a lot less of the information that you would need to fill in, and you can just really go with, you know, who talked to them, did you talk about MIPA, what zip code were you in when you spoke to them, what was the date of contact, what was the method of contact, and what topics did you discuss, as well as how much time spent did you have with them. So that's why when we did search a second ago, it showed beneficiary additional sessions. So say, for example, I was looking for that additional session that I'd had, not her original contact that she had made with Sydney, then I could put additional sessions right here, put her name in again, and locate that additional session that was in October that I conducted as opposed to Sydney. Again, with doing a search, you go to search, beneficiary contact. Standard search is what I use. If your coordinator feels like that they have more success with advanced search and they want to go into a little bit more about advanced search, I'll show you just a base level look at that as well. But I find that you've got a lot of options right here of the ability to be able to search. You can search by email, phone number. A phone number is a good one too. If, for example, I get a voicemail from somebody and their phone connection's not good and I can't make it out, but I can see the phone number that's on my phone, then I can use that to say, okay, well, let me just search by the phone number and see if I can get that person's name right there. Just really quickly here, if we go back to search and look at advanced search, then you can look at your search criteria. Again, here's beneficiary contact, here's additional sessions. If you click on that, you can search through a lot of the same stuff that's on here. So for example, if I was looking at first name, last name, equal to, so, or you could say, you know, I want to search for anybody that without this last name, or anybody without, you know, this particular zip code or anything like that. You could put add that as a column. So now that's going to be something that's in there as well. You can look at the columns and choose like that. Pick, say, well, I want the method of contact on there, but I want the method of contact to be ascending, you know, alphabetical order. I'm going to take that off there and just move on with this so we don't get something that's really confusing here. You can look at the organizational unit. Obviously, I can open this up since I've got director responsibilities on the website, that it shows all of the different regions in there. However, yours may only show your particular region. And then we'll go display options. Do you want to look at this as an HTML, as a document, as an Excel spreadsheet? I always go with Excel. I just find Excel to be the most versatile system to use. So I would just hit search, and then it thinks for a second and it wants to open it. and then it would display all of those people. Now, notice I didn't put any other columns in there for identifying information other than find everybody who I spoke to with that name. So there have been 28 people that have been spoken to with the last name Essery within the state of Tennessee, but none of the other information is on here because I did not ask for it to be included in that advanced search right there. And obviously, if you put more of these columns on here and ask for more information to be included on there, then that information would be on there. The same thing is if we go to search and we go look under group outreach, okay, yeah, it just didn't want to move on if it was still working under those parameters. But you can look, it's got the same information, group outreach and education. You can search by the type of event, the date of the event, the state of the event, title, if you only remember the title of the event, anything like that, topics discussed, all of that is on there. And then obviously the advanced search would look the same. You would have the ability to click these different things and add those in and get a example of, or the exact information that you want, rather than looking up a collective of all the events that need a particular thing that you're searching for on here. Media outreach is going to look the exact same. For team member, the standard search, you can look for team members right here. And you can just do the same thing. All the information that was asked on that team member form when we were entering them in, you can look for right there. So let's see here. Let's say last name is Jones. We're looking for Miss Shannon Jones right here. So boom, Shannon's right here. She still has the nice ship director role right there as well. And we can find somebody just like that. I'm going to get right off of here real quick here. If somebody had a nickname, then we could enter that in and find them right there. If we wanted to look by their phone number, by their email addresses, by their zip code, anything like that. If we wanted to just look at you know, all the in-kind volunteers here, all the what we coin as true volunteers in there for your particular region, that could be in there as well. You know, obviously, if I wanted to search for just somebody within, you know, First Tennessee Area Agency, or within the Aging Commission of the Mid-South, or within Tricor or Upper Cumberland or anything like that, I could make that more specific to only find all the volunteers in that region. For example, if I just wanted to say, hey, what are all my Tricor or call center agents right here? What are their team members right there? Then I can get a list of all of them right there. And again, you could go to the advanced search and do that. Let me also see if, I don't know if I can pull myself up right here. Yeah, I did want to show everybody that if you do pull up one of the team members' files, if you look right here, like it said beneficiary contact when we were searching for client contacts we done, it says ship team member right there. And where it said additional activities or additional session right here, it now just says activity. So if I were to go into activity, you know, there's no new activity right there, but if I put new right there, this is where you can also enter in your volunteer time as well. The month and year that you volunteered, how many minutes of administrative support did you do, how many minutes of ship program management or team management, other ship activities like if you attended training, for example, if you, you know, if you did anything within the program, then you could put that in there, and your coordinators can put that in there as well, especially if you are maintaining your own hours and everything. You still need to send that report to your coordinator unless they tell you that they want you to specifically enter your time, and that's how they'll check that. But just to let everybody know that we are trying to focus on trying to get this activity in on the stars. If that is made possible, then we can try to consolidate a few reports and everything like that, and I can help Sydney, who's now the volunteer coordinator for all of TCAD. She's the volunteer director of TCAD, excuse me. Then she can pull from our stars and get all of our numbers without having to look through everybody's reports and check against what's in the system versus what's been reported, everything like that as well. Now, I did want to show everybody just a few things. I know that this has been quite long-winded and everything like that, and we're almost through everything. But if I've got the reporting function right here, and a lot of these things will be on here, but if I go and look at shared reports, I have the ability to do data exports for a lot of different things. So for beneficiary additional sessions, for beneficiary contact monthly data, any particular time. So there are a couple reports that I can run that maybe everybody else does not have the access to. So if you are looking for something in particular and you can't really quite find the right way to look for it, obviously, you know, this will be something that Lori will be more responsible for once she enters into that role, and after she's been here for a little while. But once they've started, and maybe a week or two afterwards, if anybody is looking for any sort of particular report for anything specific, I can most certainly try to help everybody find anything if they're looking in particular. Again, it's not going to be something that we can make a lot of changes to. It's just going to be something like, if you're looking for what did we do in terms of additional sessions for any particular month, or what did we do for beneficiary contact in any particular month? What did we do in terms of MIPA related topics for beneficiary contacts for additional sessions? What did we do in terms of fraud and abuse beneficiary contacts or additional sessions for fraud and abuse? Right there, that information is in there as well. Now, under configuration is sort of where is my favorite portion of the STAR system. If I go and look at shared pages here, under configuration, now, I don't know that everybody else can view this. Everybody should at least be able to view a couple of these things. But under here, I have the access to look at unique IDs. So those are those CMS unique IDs. I can pull up the whole state, who all has a CMS unique ID, or if you're looking for, you know, what are the unique IDs in your particular region for any of you coordinators, I can pull that up right there. Any data export reports I can pull up as well. For our MIPA performance measure report, I just wanted to show everybody each one of those for our performance measures. For the state of Tennessee, we're going to look at, for MIPA, our MIPA grant runs from October the 1st through September the 31st. So let me go back to October the 1st of 2018 through September the 30th of 2019, since that was the last MIPA period that ended. Our current period will not end until September of this year. And then it thinks for just a second. All right, thanks for a lot of seconds, either way. And while we're waiting on that, I'll just, the resource report, this gives me all the information about how many volunteer hours, how many people we have in the state in any particular role, whether that be team member, whether it be in-kind volunteer, what is coined as a true volunteer, whether that person is SHIP paid staff. I can open that up and look at how many hours of outreach did we do last year? How many hours of client contact did we do last year or during any particular period? So, you know, for example, if we get a year from now and ACL asks, what was the effect of COVID-19 on your performance in 2020, then what I would do in that case is I would go, you know, and look at, you know, from about March of 2019 to whenever this officially sort of ends this year, and just look at what that period was in 2019 compared to what that period was in 2020. Now, I wanted to show everybody, you know, for what we did, that was October the 1st of 2018 to September the 30th of 2019. We had about 402,549 Medicare beneficiaries within the state of Tennessee, and we reached 71,373, which I'll move that out of the way. That is a 17% reached right there, so that's well above what our goals are going to be going forward in October. We were able to reach through outreach 104,421 MIPA beneficiaries. We were able to reach over 10,000 beneficiaries who are disabled under 65. We were able to reach over 23,000 rural beneficiaries, 174 Native American beneficiaries, and 827 English as a second language beneficiaries. While we reached 71,373, we had 4,318 of those contacts that we submitted applications for. That is a 6% figure. With the ease of those applications, I would expect for us to probably even improve on those numbers. However, with the pandemic going on or anything like that, I don't know, you know, what the effect will be for how people are contacting us, especially whether, since TCAD has stated and Social Security has stated that nobody would be losing their benefits during this time. You know, I'm not sure what the effect overall will be, but I would like to just say that if you look at this current date range as opposed to the prior period, what a big increase each one of those is. I mean, the English as a second language is just slightly higher than it was in this previous year, but that's also not something that you know is from lack of trying or anything like that. We can't always control the people that call and whether English is their second language or whether it's their first language. But we've had a large increase on all of these with the exception of this one right here. So that's always really great to see. And just to show everybody the resource report right here, we just do the state of Tennessee, and just for being able to not have it be too skewed or too long, we're going to go from January all the way through the end of February, just the first 2 months of this year. And while that's thinking, I'm going to go ahead and just pull up the SHIP performance measures report as well and get that thinking while I'm at that as well, and show everybody sort of how we did for skipping years again. April the 1st of 2019 through March the 31st of this year. I'll get that thinking while I show this right here. So just for the first two months of this year, we can see that we had 33 SHIP paid staff, 149 in-kind volunteers, and 83 true volunteers who worked during that time. We had 4,732.88 hours spent with beneficiary contacts. That's on the phone, face-to-face, email, fax, mail. For group outreach, we had 2,964. We typically do not do a ton of outreach for the first couple months of the year. Unfortunately, this pandemic has really cut into what is sort of our busy time. Oh, let's see here. Just gray. Let me see if can. Oh. Let me see if I can select, because luckily somebody told me that. Okay, let me stop sharing just really quickly here and make sure that I share the Adobe Reader. Okay, right here, I'm sorry. To actually show what I was talking about now, we had 33 paid SHIP personnel. We had 149 in-kind volunteers and 83 true volunteers. There was 4,732.88 hours spent with counseling, beneficiary contact. In group outreach, we had just shy of 3,000 hours right there. Typically, like I said, January and February are not our busy months. With outreach, typically it's about April through probably the end of August, maybe even into early October that we spend doing a lot of outreach. For media outreach, we've got about 51 hours and 51.33 hours. And for other activities, whether that be, trainings, administrative activities, anything like that, that's 706. We have a total of those first 2 months of over close to 8.5 thousand hours spent, which is very impressive. And you can see right here, that broken down in terms of hours spent between SHIP paid, in-kind, and true volunteers right there. And then you can always look at how many people have less than 1 year with SHIP, how many have between 1 and 3, how many people have 3 to 5, and how many people have more than 5 years with SHIP. How many people are younger than 65 with the program, how many people are older than 65, what is our gender breakdown with the program, what is our racial breakdown with the program, and then what are our languages, who has English as a primary language, who has English as a secondary language, who has who has Spanish as their primary language, who has Spanish as their secondary language, and who has other as a secondary language as well. Again, we don't have as many options for language in there as we probably should, but we don't get to control that, unfortunately. And then our performance measure for STARS, I'm going to make sure that I share that before I open it up. Okay. Okay, hopefully everybody can see this screen right here. Now, I told everybody earlier, that we had a population of about 1.27 million Medicare beneficiaries within the state of Tennessee, and you can see that right here. We've got 1,269,569 Medicare beneficiaries within the state of Tennessee. And that goes towards group outreach as well as unduplicated contacts. You can see that for the Medicare beneficiaries that are under 65 and disabled, we've got right around 250,000, just a little shy of that. And then for total hard-to-reach contacts, we've got just shy of about 841,000 hard-to-reach contacts within the state of Tennessee. As everyone can see right here, our total number reached was 116,880 contacts. We did get about 9% into reaching that population. 132,000 for outreach. We got a little bit of close to about 10.5%. Our Medicare beneficiaries under the age of 65, we ended up reaching about 7.12% of that at 17,739. For hard-to-reach contacts, we reached 86,469, which is just over 10%. And then we ended up getting above the 8% at 102,951. And as everybody can see right here, we got excellent in all four of our performance measures, 1 through 4. And then we got good, which is the second best that we could get on performance measure 5 for that. So I'm hoping that will put us pretty high. And as everybody can see, in terms of what we were able to reach the year before, we did improve in every performance measure. So that's great. It's awesome to see that, and it most certainly is due in total part to the amazing work that every single volunteer and all of the coordinators do. Y'all are the ones who make all of that possible, and should be very commended for all of that. Now, I'm going to go ahead and close that out. With STARS or anything like that, again, if you're not somebody who is going to be using STARS or anything as much, then you absolutely don't have to worry about that as much. But I find it to be a really good thing to see what goes into why we are asking these questions, why we're collecting this, and where this information goes, and how we can generate these reports to see the work that we're actually doing. I'm going to go ahead and try to check the chat and see if there's any questions that I can address here, since I was not checking those while I was presenting there. And since that is probably a very dense portion, it always is the densest. Would handing out pamphlets at a health fair or speaking to a group count under media outreach and education? Handing out pamphlets at a health fair, if you have a booth or table set up at that health fair and have that information available, anything like that, that would absolutely count under the group outreach and education, which would go under Part 2, or speaking to a group, that goes under group outreach rather than media outreach, as that would be a presentation, or handing out pamphlets at a health fair would go under your booth or exhibit at a health fair or community fair or anything like that. If you were to go to the public library and just have a handful of ship mailers and be just handing those out, something like that, or post one of them up on a bulletin board, that may be something that's like a media outreach. But if you're at a health fair giving information out, or you're speaking to a group, that would be considered group outreach and therefore would count towards performance measure 2. Do newsletters or calendars count as media outreach? Yes. Therefore not counting towards performance measure 2. Can I explain when it needs to be sent to SMP? Yes, when you're discussing fraud or abuse topics, then please do send that to SMP. I would appreciate it, and I think Lonnie would be even doubly more appreciative of that.
Now, if it's an actual fraud referral, you all need to call me.
Yeah. Somebody did get the 8675309. Thank you for at least pretending to laugh at my dumb jokes. If a family member who lives in other states asks for our help, should we log those contacts? If they are calling from another state about somebody within our state, then we absolutely want to log those, and we do want to give those assistance. If somebody who we are assisting says, hey, my insert family member here lives in Florida, would you mind giving them a call and giving them this same help? What we would do is say, actually, let me get you the number for Florida's ship, which is known as Shine, and let you give that to them. They can contact their state ship because they'll be a lot more knowledgeable on the information pertaining to their state. What category of how contacted is Tricor? Yeah, we addressed that a little bit earlier. Please remind people to include travel and setup times. Absolutely. That's another thing. When you're making contact with people, so let's say somebody calls me on the phone, what do I count in that? I count the amount of time that I was on the phone and the amount of time that it takes for me to take care of whatever they need. So I get on the phone, I collect all the information I need from that person. I get how do they want me to send that comparison to them, whatever it may be, and then I get off the phone. Let's just say, for example, that takes me 20 minutes. I do the comparison, which depending on how much they want in those comparisons, how many drugs they've got, anything like that. I count how much ever time it took me to do that. Let's say that it takes me 30 minutes to do that. So at this point, we're up to 50 minutes on that particular contact. Then I also include how much time it takes me to key that information in. So if I'm helping a particular person and I have to devote an hour to that person's contact, then that may be the case. The same thing for if you're volunteering and you're going to do a health fair and you have to drive 30 minutes to get to that health fair, please do include the time of you traveling to that health fair, the time it takes you to set up, how long you're at that health fair, the time it takes you to break down, and the time it takes you to get home in time spent at that health fair. Give yourself credit because you deserve to take the credit. If you're doing work for the program and you're on the program's time, take that credit. A lot of people may say, like, Ryan, do you really log an hour for each person? Like, doesn't that mess up how many hours you can possibly have in a day? I mean, when I'm doing comparisons for somebody, I'm also on the phone with someone getting the next bit of information as well, or I usually will try to call somebody that I know that I'm not going to have to be keying in or writing down stuff, somebody who's just calling in regarding information. So if you're concerned that you feel like that you're being unfair or untruthful by that information, please don't feel like that. Let's see here. Do ship offices have scanners to upload files and then shred to avoid paper files? Anybody can join in and say whether you don't have the ability to scan files. I know that for the most part, I would expect that all of the coordinators have the ability to scan and upload files, whether they choose to or not. I do know that all of the coordinators have shredders. We did give shredders out, God, I think it was 2 years ago now, to be able to shred things when they were replacing the new Medicare cards. So everybody should have shredders if somebody was needing to shred, like a Medicare card or something like that. Is there amount of time you have to keep paper files legally if you have them before you're allowed to get rid of them? I'd love to only have the last year on hand. From what I understand, we have to keep the last, I want to say it's 5 years. I've got that written down, at least.
Yeah, it's either
legally
5 or 7.
Yeah, right. I've got it written down because we just had to do that based off of the state's audit within the last year. So I've got that written down somewhere of legally what's the amount of time you're obligated to keep those files. Now that is, you know, if they're not, you know, kept in another form, by scanning those and keeping all of those files, I'm able to get rid of any paper files. But if you're not scanning and uploading all of those and you've not got those in that format, then you would need to keep those, I believe, for 5 years. But Lonnie could be correct, it could be 7. Let's see here. Why are the 2019 numbers still being used on the client contact form for the federal poverty monthly income and LIS asset limits? I'm not sure. I don't know if that's something that they have neglected to update since you know, all of this has happened with the pandemic or anything. You know, we've made them aware of that, but I've not made a big push for that to be changed, since it's not something that consumers see. It's just something that we deal with, and we all have the ability to be and I don't even think that many of the coordinators look on the STARS website to get those numbers. We all keep our cost tip sheet or something that has those numbers on there that we look at anyway. Yeah, thanks for trying, Booz Alex, get a clue. Middle Eastern is different than South Asian. Without an other Middle Eastern category, we'd have to use not collected. Yeah, I mean, I absolutely understand, you know, the anger about it. It annoys me as well. You know, but we do try to always make sure that we let them know that we want that to be changed, but you know, that is up to them, unfortunately. Does every user have the search capabilities or just the coordinators? I believe if you're a SHIP team member, you should only be able to see the information that you have put in. But I believe that if you have one of the roles higher than team member, you should be able to search everybody else's, but you should have the search function and be able to search your own information in there. Yeah, it looks like that the difference between true volunteers and in-kind was explained in the chat there, right there. Could we use the SHIP office computer and printer for training materials? You will have to ask your coordinator regarding that. How do well persons who are deaf or blind, I would assume that files have to be saved for 5 years. Yeah, thank you. How do we help people who are deaf or blind, I think would be the question that was intended right there. We do have interpretation services that we do try to use. Admittedly, you know, for deaf and blind is typically harder than having a interpreter for another language. Typically, we do have to, you know, set time and dates for that a little bit more, and it is a little bit harder, but we do have the ability to, you know, find those resources and try to get those set up at there. You know, if of course they do not have a family member who can come and you know, if deaf, use sign language, or if blind, you know, obviously we can speak to them, but I do know that for sure, and Sheila, Tina, and Joyce, y'all can correct me on this. I know that y'all have at least Braille materials on the Medicare and U handbook. Yeah, Sheila just commented. Yeah, there are Braille Medicare and U handbooks, absolutely, because I do remember that y'all have seen that. And Adrian stated, don't forget to change the SIRS, e-files, ID on STARS if you're submitting for another counselor. Absolutely. Is it possible to make corrections on STARS data entry? If you go and search that person, I believe that you cannot go in and edit that. Let me check that. Let me see here. I don't know if it'll boot me out here. Everybody just hang tight for just 1 second. I promise that I won't be gone momentarily. And Sheila did state that they have a Medicare and U handbook on CD as well. I'm just checking this right here.
That sounds like a good read if you have trouble going to sleep.
Yeah. Oh, that's still me. Hang on 1 second, y'all. Yeah, that does happen from time to time. Lonnie brings up a funny point is, you know, when dealing with people dealing with Medicare, when we deal with people dealing with Medicare, Medicare can be quite frustrating. And, you know, there's plenty of times that I find that a lot of what goes on does not seem very fair. And I feel like that a lot of people would agree with a lot of different situations that don't feel particularly very fair when they're trying to accomplish things. Medicare has a stance that ignorance is not an excuse for a lot of things. And somebody will say, well, who even reads their Medicare and U handbook? And fortunately or unfortunately, depending on, you know, how drowsy you get late in the night, you get to say, well, I have multiple times.
Ryan, someone just
yes.
asked, where can you get the Medicare and U handbooks CD?
You can download, I know the handbook, and I believe you can download the audio from CMS, but getting it on CD, Sheila, would you have any insight as to where somebody could order that? Do you order that on an annual basis? If you want to if you're on the phone and want to speak rather than type it, I did unmute you if you just wanted to talk.
I was, you look at for the CMS product ordering, you can set up your own account. And once you're in there, you go to the Medicare and U handbooks underneath the Medicare tab. And under there is a choice between Spanish and Braille and CDs. Right now you can order 2020 and 2021. Still, they even have Spanish Braille. I don't think the CDs for 2020 are available, but they are available for 2020. Oh no. They quit the 2021 ordering. Sorry.
Yeah. Unfortunately, that ended, I think, last month. But you can order right here if you go to. Yeah. If you go to download, you could do that later on.
You can order 2020. You can only order 5 of them. It's on the very first page of the Medicare and U. So if anybody has an account for the CMS, then they can order, or you can go to the CMS product ordering and set up an account. Or you can talk to one of your coordinators and we'll be glad to get you some.
Right here, what she somebody had put down in the chat the link, and if you just click right, it'll go back. Download Medicare and You. If you click that, then it gives you all these options that we were just looking at right here, large print, PDF, everything like that, right there. Yeah, great way to get a lot of Medicare information.